This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed.
And I now declare the meeting open to the meeting of the Health Committee Public Online. I'd like to welcome all of our members who are participating by video conferencing this morning, and also can I remind members about the protocols regarding the use of electronic devices. Maidin Moya agus ta fáte róh lig maidin gallant a seo all on this next morning, and I'm also going to start off there with apologies. No apologies received this morning. Are members aware of any other apologies? No. Okay, thank you, members. Moving on then to the draft minutes, members there. Item 3, I refer you to the draft minutes of the 11th of March at tab 3.1. Are members content with those minutes? Content, yeah. Thank you, members. And I can advise members that there are no matters arising. So, members, we're moving on then to our first substantive briefing this morning, which is a briefing from Patricia Donnelly on an update into the vaccination programme. I refer members 5 of your pack, which include copies of recent correspondence received by the committee regarding vaccination. Also, members, included in your table pack is a slide provided by the Department. I can advise members that Patricia Donnelly from the Department of Health is here today to update the committee on the vaccination programme. And members, we are expecting approximately 45 minutes for the session. So I would now like to welcome also by video link Ms. Patricia Donnelly, who is head of COVID-19 vaccination programme. Good morning, Patricia. Are you able to hear us okay? Hi, Patricia, can you hear us okay? We're not hearing you, Patricia. You're not on mute, but I'm wondering, is it your headset? I can see you and I can see it speaking, but I'm not hearing you. No, we're still not picking up your audio, Patricia. It may be a setting on your side. No, still nothing coming through. And Patricia, just check your headset. There can be an on-off switch on the headset. There's also a volume button potentially, but we are seeing you clearly, but we're not hearing from you at this minute. No. Okay, what I might need to suggest then, Patricia, is that we take a short pause to see if we can get, or if you can get some assistance on your end. The system here seems to be functioning this morning fine, but I'll take a short break there, Patricia, and we'll just ask broadcasting. Well, yeah, I'll take some advice from Clark. Clark, it's usually better we stay on there, isn't it? Broadcasting can.
I think we can pause broadcasting just for a minute or two, and then we'll get access and get back up and start it again.
Okay, so please request a pause then, a suspension of broadcasting for a minute or two. Thank you.
This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed.
Thank you. So welcome back to Fáilte Arasharish members, and we do have that issue just now with Patricia. So once again, I welcome Ms. Patricia Donnelly, who is head of COVID-19 vaccination programme. And Patricia, if you would like to just go ahead, please, and brief the committee on the latest update on the vaccination programme. Thank you.
Good morning. Thank you very much indeed. Apologies, not quite sure what happened. Thank you very much. I think I have a slide that you've previously seen that someone's going to display, and it's the programme plan, so I'll just update you on that.
Well, if I can just ask then broadcasting to bring Brandon into the spotlight. So Brandon, activate that screen share function. So broadcasting, can please bring Brandon up. And we'll just pause. I'll let you know when we're seeing the slide on our screens, Patricia. I'll give you the indication then to resume. Thank you. Okay, I see Brenton is now in the spotlight. Brenton, can you screen share the slides from Patricia, please? Thank you.
Sorry, Chair. I'm just trying to share my screen as well, but it doesn't seem to be. Oh, that should be it now.
Thank you, Brendan. Could you put that into presentation mode? Failing that, if you just increase the size, that would be helpful. Thank you. That's fine. I think I can speak to that. Members should have a copy of this in their pack, and you will be familiar with this. This was the programme plan for the COVID-19 vaccination, and you will see from it that we had a number of phases, and we've completed phase 1, which is prior to group 1 and 2, and phase 2, where we moved from the down to the through the age groups, 75 to 79, 70 to 74, then the clinically extremely vulnerable, and on down to carers and the at-risk vulnerable group. And you will see that we have virtually completed this group, and we have commenced priority groups 7 to 9. So as of earlier this week, we called out for the 50 to 59 year olds to come forward. We've had a significant response to that. And as of close of play on Tuesday, we had administered 704,000 doses of vaccine, both of AstraZeneca and of Pfizer. And of these, 640,000 people had been vaccinated. We expect yesterday to have been another very busy day. And GPs had a lot of clinics running yesterday, and most of the vaccination centres continued to operate. You will see that our intention had been in the month of April that we'd go below the age of 50 to the remainder of the priority groups, which are 10 to 12. That runs in 3 groups, from the 40 to 49-year-olds, 30 to 39, and then 18 to 29. And later on, a further booster vaccination program in the autumn or the winter. And I think if we can just look to the right of that screen, you'll see there's 4 main elements to our program. It was the 7 vaccination centres that are currently operating. Yes, if you just scroll down, yes, the 7 vaccination centres that are currently operating, they're very successful. There have been mobile teams that were going out to care homes, and they've all completed their work. The 321 general practices who are very actively operating at the moment, and they've already delivered over 300,000 doses to individuals. And the small teams of district nurses and GPs who were going to new and temporary care home residents and to the housebound. And you will have heard of the mass vaccination centre, which is at the SSE Arena. That as the main vaccination centres were fully preoccupied with second doses, we opened this as a further opportunity to increase our capacity during April and May. And also delighted to say that community pharmacy, I think that number is now 350 community pharmacists that will also begin on the 29th of March, and they will be assisting us to work through the age cohorts, and that will be the backbone of our winter programme. If we take down the slide, that would be helpful. So to date, Chair and members, you'll see that our programme has been running very much to time. We're slightly ahead of our schedule. Each time a cohort starts to slow down in their booking, we open up another. And we've had a steady vaccine supply that's enabled us to do that. We had an opportunity early in March with a very large bumper dose of AstraZeneca, which was a bonus that I think wasn't on our original schedule, and we've deployed that out to GPs and to some of the vaccination centres. The only restriction had been this was short shelf life and needed to be used by the end of March, but plans were already well advanced for that to be done safely. And I'm happy to report that that is already underway. You will have heard from some national media that the second bumper dose that we were expecting at the end of March has now been delayed until April. We had not wholly counted on this as part of our plan. I think I indicated before that we're try to be flexible about the way we deliver this. So by having a larger number of individuals, by having a group of both trusts using Pfizer largely, and then GPs and the new centres coming on board, that we would use AstraZeneca and Pfizer in combination. We have since, in the last few days since we were aware that there would be a change in the delivery schedule, we've adjusted our plans accordingly. So anyone who's already had a booking, it will be honoured. Anyone who's expecting a second dose, that will we have vaccine reserved for that. But we're also hoping to continue with some first doses during the month of April as well as the remainder of March. And we've been able to do this for a number of reasons. We have, first of all, maintained 3 of the trusts continuing to use Pfizer, because we've got a slightly improved delivery schedule for that. So we're not wholly relying on AstraZeneca. And we have scaled down slightly the opening weeks in the SSE Arena. It has the capacity for 40,000, but in the first weeks, we're looking at 11,000, building up to 20, and then up to 30,000 in subsequent weeks. And we've also met with the community pharmacy representatives to indicate to them what their delivery schedule would be. And that will be going out to them next week for them to be able to book in individuals into local pharmacies. So we've tried to keep a very balanced approach to this. We've also been cautious about how we've approached the use of the vaccine, and anticipated that where there were difficulties, we would very closely match the vaccine supply to the booking platform, so that we only would open up slots when we were able to have the vaccine to support them. So for anyone who hadn't already booked a slot, there will be some coming available. We're just asking them to be patient, Chair, as we run through the next few weeks. So happy to take any questions.
Okay, thank you, Patricia. And also just initially to acknowledge and I think welcome the fact that the vaccination programme has to date been extremely effective, and it would appear very efficiently rolled out. And I think we all welcome that, and I think the committee and the public welcome the fact that that this vaccination is a key element of how we will move out of this pandemic and the crisis that has engendered. But in terms of that cancellation of that order which you referred to there, what is your impact in terms of a delay to the overall programme? What is the likely impact of that cancellation on the programme that you were looking at yesterday or the day before that was announced?
Well, I think worst case scenario, Chair, it probably puts us back by 4 weeks. The mitigation measures that we put in place, we hope will only delay us by 2 weeks. So it won't have a huge impact. We had hoped by the time we would launch the SSA Arena that we would be opening to the over 40s. I think that will be maybe delayed by 2 weeks, but we'll keep that under review, and it will very much depend on the remaining deliveries that we get from AstraZeneca. But as I said to you earlier, we have tried to find some mitigation through further use of the Pfizer vaccine. So it will slightly delay it, but it won't, I think, reduce our plans overall.
Okay, and how is that factoring then into the advice that the Department of Health and the Minister for Health is providing the Executive in terms of easing of restrictions? And I mean, clearly, as we ease restrictions now, you then anticipate that you will have to address further problems that arise from that. I met with the contact tracing team a couple of days ago to see how they were kind of match ready, in the sense that they now come back into the very critical spotlight that contact, find, test, trace, isolate and support needs to be functioning better now as we start to ease. But in terms of the easing of restrictions, what impact do you think that 2 to 4 week delay might have?
Well, the Minister's been very aware of these plans all along and been very aware that it is vaccine dependent. So the overall timings that we've been given to him haven't changed substantially. So I'm sure he's factored that into his advice. But I would think that would be very much a question for him rather than for me, Chair.
Okay, thank you, Patricia. And then in relation to communications with the BAME communities, and we are aware, I think that many of these workers who have come and have added to our economy very significantly over recent years, but many of whom may not have English as a first language, many of whom work in particularly vulnerable sectors such as meat plants, food processing, and indeed domiciliary care, where risk of transmission is known to be greater. Also, many of whom may be working in houses of high, or living in houses of high multiple occupancy, and who may be further unnerved by all of the Brexit changes and things in terms of their status. So I think that's a particularly vulnerable group, particular difficulties around communicating with them and in terms of uptake of the vaccination. So can you outline for us what communication strategy or engagement strategy you have with those types of communities?
Thank you very much, Chair. Well, we're working very closely with Public Health Agency colleagues, both analysing the uptake and looking at where we need to target the messaging. So where we become aware that there might be particular issues within a community, I think the standard approach is that you look at the messaging that would be appropriate to that group. And I'm very aware that some of the kind of national strategies that have worked very successfully have been around using senior leaders within that community that would influence the behaviour of others, and also looking at social media media that would be targeted specifically at an individual group. But we're very much at the beginning of that, as we are getting more information about the uptake to date, and where we become aware of it, we've tried to develop campaigns on the back of that. So it's not that there's a single straightforward answer to each one. I think it needs to be tailored for each of those communities. But you're quite right that it's very often the kind of fears, very specific fears, potentially within an individual community, that need to be addressed very directly. Some of them are health fears. Some of them are around some of the adverse I think information that would have been available for those who have very strong anti-vax views, and I think that can be very frightening to someone who's already a bit hesitant. So we're trying to target those very directly and use health experts where we can, and as I said, use those senior leaders and influencers within the community.
Thank you, and yeah, thank you, Patricia. We will, I suppose, keep an eye on that, but I do welcome the fact that that work has started, because I think it is of critical importance. So thank you for that, and anything that we as political representatives can do to assist with that engagement with those communities, I think we would all be very keen to do that, because we're keen to support both you and those communities and those workers who are in very increased vulnerable frontline situations. So thank you for that. The final one from me then, Patricia, before I go to members for questions, is around the very, again, welcome news that the community pharmacy are now being brought forward in terms of providing assistance to this. And I think you've said that has gone from 300 now to potentially 350 pharmacies. We are very aware within the committee the central role that community pharmacy has played throughout, and indeed before, and hopefully will play after this pandemic. So I think that's to be welcomed. Even just the fact of bringing it to community level in that sense is a good development. But again, in relation to the delay in supply, how confident are you that we will have enough supply to get the maximum impact out of community pharmacies' skills, network and experience?
Well, thank you, Chair, and we very much welcome your support for community pharmacy, because you're right, it's that local accessibility which is going to influence the uptake. Well, community pharmacy had already advised us that they wanted to have a slow beginning to build their confidence using these vaccines, because they're somewhat different to that they've experienced previously. So the reduced vaccine supply plays into that slightly, in that we are making vaccine available to every one of the pharmacies that have signed up for the programme, and it means in the first few weeks it won't be huge amounts of vaccine, but it'll be enough for them to gain experience, both in administering it, in doing any observations after it, and in being able to ensure they don't waste the vaccine. That's been considerable concern to them, because a punctured vial can only be maintained for 6 hours, and the vaccine has to be used. So them making sure that they're able to get enough people in that time to vaccinate, I think they'd felt some anxiety about it, like others, treating this as a very precious commodity and not wanting to waste it. So they've worked out and worked very well and closely with the department's teams and the digital team in using the vaccine management system. So I think their preparedness, I think, is well underway, and I think it means they will make a slower start, but I expect that by the time we get to the higher volumes of vaccine available, that they'll have a lot more confidence about managing the vaccine. So it's very appropriate then that the higher volumes will come through at that point. So I've enormous confidence in this sector, both being able to deliver now and into the future.
Okay, and just before I do go to members then, what steps are being taken to counteract the delay that has been announced? Are you in active negotiations to try to replace that supply via other vaccines or via other producers? Are you actively seeking to head off that reduction in supply by other methods?
Well, there are members of the team who are engaged several times a week with the UK. You will know that our vaccine is procured through Public Health England, and that we get our 2.85%. Therefore, it's very much down to what they're able to procure on our behalf. This vaccine that is delayed was a bumper delivery schedule that we hadn't expected. I mean, this came very late, this announcement that we would be getting this. So in some ways we hadn't counted on it. We very much welcomed it. So while it's disappointing, it's not, as I said, we're not, our plans are not offset too badly by it. We have got increased amounts of Pfizer, and I think that's been always very steady for us. So that's enabled us to offset it in some way. So we're in constant communication around that, and hopefully, our steady supply that we've had up to date will continue through the month of March. We've no reason to believe it won't.
Okay, thank you, Patricia. And I will now go to our Deputy Chair, Pam Cameron. Go ahead, Pam, please.
Thank you, Chair, and thank you, Patricia. Once again, I still think you're the most popular person in Northern Ireland, for sure. I want to say well done. A fantastic rollout to date. I think we're all very proud of that. So thank you and the entire team. And if you'd pass that on. I wanted to ask in and around the delay as well. It's good to hear that the delay in the AstraZeneca supplies won't have too great an impact. And the Chair had touched on other available vaccines as well. And I wanted to ask you around that as well, whether you're expecting any new of the booked vaccines to become available anytime soon, if you've got any heads up on that. And also, I suppose, when or if you do receive another bumper supply, as you've described it, I suppose you will still have the opportunity then, especially when you have the facility of SSC on board, to really ramp up the time. And I understand you've toned that down for the initial weeks, but that really could ramp up greatly to up to 40,000 a week. And I presume that you're still keeping the option open of 24/7 rollout if that would become possible in terms of supply. So if you could answer me that one. And I also want to ask around the pharmacy role in vaccination, which is very welcome too. A lot of people will be very comfortable going to their own local pharmacies as well. I think that's also very handy. But I presume that pharmacy will have a huge role in kind of an annual or booster rollout in terms of future winters and years, just as they do have a role in the flu vaccine rollout.
Thank you very much. If I deal with them in the order you've asked them, the other vaccines, we knew that Moderna is already approved by MHRA, but we haven't had any supplies of that yet. We get schedules that are suggesting it'll be there sometime in late spring. We've got no exact information on that. It'd be very welcome if it comes, but we weren't relying on it. And as you say, and I appreciate that you're recognising that that additional dose of AstraZeneca that we're expecting is coming later in April. So it's not that it's disappeared completely off the schedule. So it does push things a little bit further back. I mean, the one advantage of the SSA Arena is that we can run many lines in it. So you're able to operate quite a high rate on an hourly basis. We're initially opening it for 12 hours a day. We can extend those hours if necessary. But we have the capacity to ramp up significantly. And by the time I think the higher volumes of AstraZeneca is available, we will and should be able to get up to those 40,000 a week, which you'll understand is a significant number. But the other vaccination centres are still operating. The only one that will stop for first doses is the one at the Ulster Hospital, as South Eastern Trust are running the SSA Arena. So the others will still be operating first doses right through April. So that is of great support to us, as is the GP programme. And of course, pharmacy offers us a completely new opportunity, and as you say, very active this last winter in the flu programme, and we expect that to be the case this winter coming. And the booster dose, we're waiting to hear what vaccine will be used, which population will be targeted, if it's a single dose, when it should start. When we have all that information, which will come from the expert advisory group, the JCVI, then we'll know the best way to devise the programme for the winter. But I have no doubt community pharmacy will play a large part in that. And I think it's very welcome, I think, by the public as well as by the programme.
Absolutely, thank you. And just finally from me, Patricia, can you tell us any more about the vaccine efforts in the special schools, whether that's complete, and is there any prospect of further sectoral approach in the education sector in particular now that the plans are to get the kids all back into school?
Thank you very much. There's 696 special education staff who've been identified and named to us. The names were provided to the vaccination centres, and I understand as of yesterday or the day before that most of those are already booked on, so that was very welcome. The team at the Public Health Agency have done further work, and it was looking at those children within the normal school sector, which would also fall into the same category of neurodisabilities where individuals supporting them might be better vaccinated, and that work is underway. So we've yet to hear a final outcome from that. I suppose since we last met with the committee, JCVI has reported and designated that the speediest way to vaccinate the community is to drop down in 10-year age sectors through the rest of the programme. They will keep this under review, and if there is further advice about pulling forward an occupational group such as teaching or police or any other, we will immediately react to that. But as of yet, we've received no such guidance.
That's super. Thank you so much. Thank you.
Thank you, Pam. Thank you, Patricia. And I'm going then to Carol Killen, then Jonathan, then Orlia, and then Paula. So go ahead, Carol, please.
So thank you, Chair, and thank you, Patricia. It's very encouraging to hear of the progress up until now. Patricia, I'd like to ask about, so I'm declared 2 interests. I'm in the 55 to 59 category. And I've been trying to book on for a vaccination and I can't do it in Belfast yet. So it's really just to say, is it definitely the 29th of March that the SS Arena will be opened, and are there facilities to book on in advance of that? The other question that I would have is, what is the staff complement needed to run the SS Arena? And then finally, just to continue the question that Pam had raised, and the second interest is I have family working in the education sector. So the JCVI has kept under review the different sectors that should be vaccinated. However, we have received a massive amount of correspondence in relation to certainly special educational needs schools, but also now the whole school community. So it's really just and indeed other frontline services. So it's just to try and get a response on those, Patricia, if you can, please. Thank you.
Thank you very much. Well, I'm disappointed you weren't able to get into the Belfast centre, but there are appointments available in other centres. The SSE Arena will definitely open on the 29th, and we expect to open the bookings next week. So and at the same time, we work with Belfast, and several weeks at a time, we then open up the next set of bookings. So we're trying to do that, you'll understand, to manage vaccine supply. So once we're certain of a certain supply level, then we open up more appointments. So getting through the 50 to 59-year-olds is a kind of rolling programme of opening up appointments. But what you should also be aware that GPs are also calling the 50 to 59-year-old. So you may find you get a call from your GP in advance of that. And if you do, I always advise people to take the earliest appointment you're offered and stick with it. So you may find that you get it a bit quicker than you'd maybe expected. I do feel I do understand the anxieties that people both in schools and other sectors have when they look at their own individual exposure and etc. But this expert advisory group have looked at the individual risks in this, and they have based their advice on that. So in the programme, we react to that. We don't make that policy, and therefore we just observe that and wait for them to advise us which groups to vaccinate first. we will get to everyone as quickly as the vaccine is available, and I would hope that many teachers, I think, probably already have been vaccinated because of their age profile. But for those others who are remaining, I know it's an anxious time, but it'll only be potentially a matter of weeks before we're able to drop down through the age ranges again. And the final piece that you asked me is about the SSA arena. Well, we're remodelling the staffing now that we've ramped down our expectations. We knew that we needed a large number of vaccinators to cover a 12-hour shift, and we have I think over 700 people, I think, who've stepped forward and potential as vaccinators for it. Now they'll be in shifts, and they won't all be used in that first period because we don't need them all in that first period. What people aren't always aware, it's not just vaccinators, there's a lot of other people to support. So we did identify there was about 120 admin staff that are needed, and we've welcomed those who've stepped forward to fill those roles, because that's an important part of it, coming in and getting booked in and getting yourself through the system. So it'll be a large, busy team, both from car parking right through to vaccination and beyond.
Patricia, sorry, Colin, it's very quick. The issue is a lot of people in Belfast, particularly those living in deprived communities, can't afford to travel to Fermanagh, Omagh, Derry or Ballymena. So, and we've all been advised not to ring our GPs, to let the GPs contact us. So I do think there is a job of work to do regarding communication about SS Arena, because I have, as a Belfast rep, been receiving phone calls, and if we could just, do something about the communication on that would be really greatly welcomed.
Well, we've tried very hard to have a good communication plan. We're usually releasing information every day. For example, when we realised the 60 to 64-year-olds were a bit slower to come forward, we targeted some of that to try and push it. But GPs are locally based. They will be calling people, and the local pharmacies will be available from the 29th of March. For the very reasons that you're stating, for those harder to reach, where it's less accessible. But GPs are actively calling at the moment, and they're particularly, I think, picking out those that they believe are going to find it more difficult to access those further afield. We will make sure we didn't want to, until we were absolutely certain of what the capacity would be in SSE, we didn't want to open up those slots. We could have opened them up this week, but I think we made a decision to open those early next week, but we'll keep that under review as we look at the demand for the other centres.
Okay, thank you, Carol, and thanks, Patricia. So going then to Jonathan Buckley. Go ahead, Jonathan, please.
Thank you, Chair, and thank you, Patricia. I have to say I'm extremely proud of the way in which the vaccination programme is rolling out in Northern Ireland. In the beginning, I said that I wanted to see Northern Ireland being a world leader in vaccine rollout, and it has lived up to every expectation that I could have had, along with the rest of the United Kingdom. So we're hugely proud of the work that you're doing and continuing to do. That contrasts starkly with the approach that the European Union have taken with regards to vaccine rollout, and in particular with relation to the vaccine nationalism surrounding the AstraZeneca vaccination. So I would just like to maybe get clarity from yourself. Has there been any issues with the AstraZeneca vaccination in Northern Ireland? And also on that exact point of AstraZeneca, how will the suspension of AstraZeneca rollout in the Irish Republic influence the pathway to recovery in Northern Ireland? And are you aware of what contact there has been between the CMO in both jurisdictions throughout this period?
Thank you very much for your comments, and the team very much appreciate this. It's a huge team effort across Northern Ireland. There are very many hundreds, indeed probably thousands of people involved in it, and that's what it takes to have a successful programme, that kind of commitment from all involved. We haven't had any issues with AstraZeneca. We have a yellow card system that any abnormal or notifiable reactions to the vaccine is reported to MHRA. And so we're still acting under the approval of MHRA, who remain confident that this is a safe vaccine. And we would want the public to have that confidence coming forward. This is a virus that is of enormous threat to so many people, and being vaccinated is certainly the first step towards that individual safety that is so importantly needed. We don't yet know what the suspension of the programme, the impact it will have on us, and I think the matters of kind of policy, etc., for CMO are really a matter for him rather than for me. I'm not aware of what the contact is, but I'm sure there has been contact, and we're pretty single-minded. The reason we've been successful to date is we are single-minded in the programme. We just want to get it done. We want to, identify any problems that there are, try and resolve them as we go along, try to make it as free from bumps as possible, but inevitably there are some. And the recent vaccine supply issues, the recent issues and anxieties that have been around the vaccines really don't deter us from trying to make sure that we just keep people's confidence in the programme and keep delivering it as effectively as possible.
Okay, and thank you for that. And the comparable rate, even between ourselves and the Republic of Ireland in relation to vaccine rollout, is testimony to how single-minded approach that has been in terms of trying to get as much vaccination into the arms of the general public as possible. So we do thank you for that. Could you outline perhaps what are the stocks available of Pfizer vaccine and how these are being used? And finally, if I may, GCVI have indicated the need for priority access for homeless people in relation to vaccination. This is something that should concern us all. Their ability to access even information about vaccination is low. Could you please elaborate on how that is being implemented in Northern Ireland to ensure that those that are unfortunately homeless within Northern Ireland can have access to vaccination and also communication to ensure that they get vaccinated safely?
Thank you very much. Indeed, there's a very successful winter flu vaccination programme for the homeless. So we've worked with Public Health Agency and colleagues within Trust to identify individuals. We were only ever going to use the AstraZeneca vaccine with the homeless because we couldn't be sure about the dose interval for some of them. You needed to be able to be flexible. I think some will be done through hostels. And again, I think they've got some plans around those rough sleepers that aren't as easy to deal with, but would their locations are well known, and I think there's a programme underway, partnership between Public Health Agency and the trusts to deal with this highly vulnerable population. So we've been aware of it. We've plans in an advanced stage and expect that to be delivered at any point. In fact, probably some of the trusts have commenced that already, I would think. And to come to your second issue, which is around our Pfizer vaccine supply, we don't keep big stocks of anything. When it comes in, we know what's coming in. Pfizer's been very reliable in the way that it's come in. When we know what's coming in, we allocate it immediately. Our original plan had been that we had a contract for 1.14 million doses of Pfizer vaccine. That would have been for first and second doses. Therefore, we always knew we needed to manage within that limitations. However, the contract was over a long period of time, up to September. So what we've tried to do is then use it very effectively in the first months of it, and then slow down our use of it as to guarantee that we would have our second doses at the appropriate time. What that's meant then is that we had a plan to migrate all of the trusts out of Pfizer into AstraZeneca, as it was the vaccine that had the highest volume coming, but we've slowed that down. So only 2 trusts at this stage are using AstraZeneca, and the rest we're using Pfizer with, and we'll continue with that while we've got, we're keeping that steady progress with our deliveries from Pfizer. So as I said, it's not that we keep a large stock. We don't. As soon as we identify it coming in, we will only have enough to kind of turn over the stock and release the rest for immediate use. It comes in large packs, if you remember, of over 1,000 doses a pack. So it's easier to distribute and it's easier to identify, but it's not very flexible about how you use it, and it can only be used in these large centres.
Okay, and thanks, Patricia. Thanks for your own personal accessibility as well throughout the programme. I know I've emailed you personally and you've come back very efficiently, and also your ability to get out there and reach in the media as well. I watched a very interesting programme of Talkback with an elderly lady who had no communication in relation to vaccination. For you to be able to give her the reassurance of trying to get somebody out there was certainly good to hear, and I hope that there's as much uptake as possible so we can get to normality as quickly as possible. So thank you.
Thank you, Jonathan. Thanks, Patricia. Moving then to Orlea Flynn, and then I will have Paula, Alan, and Cara Hunter. So go back to Orlea. Go ahead, Orlea, please.
Okay, thank you, Chair. And just similar to the other members, Patricia, I want to offer my thanks to you and to all of the team for all of the tremendous work you have put into this vaccination programme. It is muchly appreciated, so thank you for that. My first question, Patricia, is I'm not sure if we've had some feedback from some local surgeries in West Belfast and from some of our constituents around some vaccine shortages within certain GP practices. And I'm wondering, are you noticing any fluctuations with shortages among the GP practices? That would be my first question. I know there's the vaccine timetable for the different practices. Are you finding any issues with that, Patricia?
Well, there are always issues because up until we had that very large delivery at the beginning of March, which was now seems like a long time ago, but it isn't very long ago, we had steady but small supplies. So what that meant was there's 350 GP surgeries across Northern Ireland. So to be very fair to all of them, there was the primary care team at the health board and members of the department's vaccination team really looked at what would be the fair way to distribute. So they looked at each practice and the age group we were vaccinating at the time and the size of the population within that practice. And then they allocated the vaccine on that basis. So they've tried to do that carefully. And that meant that sometimes individuals got a pack. Now, a pack could either be 80 doses or 100 doses. We're not supplying vast amounts here, but you can understand that for 350 practices, you've already got rid of 35,000 doses. So you can very quickly consume your vaccine supply. So what we would try to do is make sure that we did it kind of carefully, and that if someone had maybe 150 people within an age group and you're only able to give them 100 one week, you try to address it the following week. And that meant that not everybody got it in exactly the same way, but they got it with the same principles, which is, looking at what the demand would be within their practice. And also, since last week, we're now aware that some practices are coming up to second doses. So we needed to make sure that they had enough vaccine to do second doses. And that would mean that a practice could look at a neighbouring practice and think that someone was getting more, but it might just be to do with the profile and the age profile of that individual practice, or how many clinically vulnerable people were within it that we'd be aware of, that we would try and match. So it's very frustrating for GPs. Fully appreciate that. Try to communicate with them as well as we can. We work actively with the leaders within the profession and meet with them weekly, sometimes 2 and 3 times a week when we have to talk through the strategy, to talk through the principles that we're operating on, to talk through the practices, to hear where things were difficult. So we know it feels a bit uneven. If we had more, this is not the way you would do it if you had any other options. Quite frankly, the easiest way to do it is to get all the vaccine in, stockpile it, and then divvy it up so that everybody is comfortable, they've got what they need. But we haven't been able to do that. And in fact, it's been more important to get people vaccinated. So it does mean it gets a bit uneven. We had hoped in the month of March, all of that would turn around. So although we've got a couple of bumper weeks here, we're going to have a couple more steady weeks ahead. And then the vaccine, I think, hopefully will improve after that.
No, and I appreciate that rationale. Patricia, the surgery in particular that I was speaking about was actually telling some constituents that there was going to be a 3-week gap until they received more vaccine, but I have wrote off just individually around that case. But thank you for that information. And just finally, Patricia, you mentioned earlier, so hopefully come April, you might be able to do some first doses. And has the vaccination programme, have you predicted a sort of a ballpark figure on how many first doses you are trying to work towards, given the limitations possibly with the amount of vaccine? And is that going to be including then the over 40s?
We had modelling done, which is on the basis of the vaccine that we had and we had expected, and we had hoped that we would have done a very high number. We are at 740,000 individuals, and over 640,000 individuals, over 704,000 doses. We had hoped that would be up over 700,000 by the end of March. We'll keep an eye on that. If we can do that, we want to do it. And it will very much depend on being able to manage the remainder of this vaccine stock that's coming in. Our plan had been to get to the over 40s by the beginning of April. It will be later in April. I hope at the very latest it'll be at the end of April, but if we can bring it any time further forward, we certainly will.
Okay, Patricia, thank you very much. All the best.
Thank you.
Thanks, Orlia. And going then to Paula Bradshaw. Go ahead, Paula, please.
Thank you, Chair, and thank you, Patricia, for coming this morning. My first question is around those people who have been shielding the CEV group, and I just wonder if part of the delay in some of them coming forward may be concerns around the vaccination centres, and can you please confirm or otherwise whether there have been any outbreaks of community transmission linked to any of the vaccination centres? Thank you.
Okay, there's been absolutely no outbreaks in vaccination centres. Everyone in the vaccination centre has been vaccinated, and they will already have had their second dose. And we've had absolutely no incidents whatsoever within vaccination centres. And I do understand that for the clinically extremely vulnerable, it is difficult to come out of shielding to go to vaccination centres, but GPs are also calling them, and so far, I mean, between those and the at-risk group, over 120,000 have been vaccinated. So some people are taking that courageous step for them to come forward. I mean, they may want to find or have more of their friends and colleagues and fellow citizens vaccinated before they feel completely safe, but we're getting there with that, and hopefully that will build their confidence.
Thank you. And just moving on from that, the last time at the last health committee when you came, you mentioned that people who were shielding should have the 2 doses, then 2 weeks to build up immunity before they would return to work. And I hope I'm not putting words in your mouth. But those who've shielded, they couldn't find the confirmation of that sort of advice anywhere. So I'm just wondering, is that the actual position? And if it is, then could you maybe convey that should be put on NI Direct?
Can I clarify that it isn't I think in answer to the question that I was asked at the time, I was saying that with immunity, that you would expect you would only have immunity 2 weeks after. So it was a separate question than the issue of CEV. I think the advice is still for those who are CEV to make those individual decisions about it, to work at home where they can. So the advice is still around that care that they need to take at an individual level, and to assess that. But I didn't expect that for anyone to believe they would have full immunity or the highest level of immunity until at least 2 weeks after their second dose. So those are 2 separate issues.
I'm sorry. I thought it was in reply to a specific question that Jerry had asked you about shielders. So just moving on, then the final question. When the health minister was last here, he had mentioned that once you got past priority group 9 and then moving into 10 to 12, that there would be potential then for the vaccination centres, the mass vaccination centres, just to open up for everybody 49 and under. Are you then saying today that you would be, given the supply issues, that it would go down to 10, 11, 12, sort of in order of age groups as opposed to just mass opening? Thank you.
Yes, I think we will have to go down to the 10, 11 and 12. I think we would need to do it. Those are very large groups. So, in fact, it would be very frustrating for individuals, I think, to wait too long for their appointment. So if the vaccine supply flows later in April and into May, then we will be able to open quite quickly, one after the other. But we're not just relying on the mass vaccination centre, but as I said, community pharmacy will be able to kind of supply through that. So it is more likely that we'll drop down, but we'll keep looking at that because that's something we need to revise as we go.
Okay, thank you. Thank you, Chair.
Thank you, Paula. Thank you. And Alan Chambers. Alan, go ahead, please.
Thank you, Mr. Chair. Patricia, I want to be associated with all the remarks of congratulations about the programme and how it has been working out. It's certainly been a wonderful example of teamwork. In relation to the pharmacy community becoming involved in the vaccination programme, and I certainly welcome that. That's another addition to the team. How will you maybe flesh out how it will actually work from an admin point of view? Will patients be directed to a pharmacy by their GP, or will they simply walk into a pharmacy and fill in a form and then their GP be informed? So just how will the admin of that be handled? In terms of we're delighted to hear about the military assistance that we were going to receive for our vaccinating programme. Are those military personnel being deployed currently, or have they had to be sort of put back because of this unfortunate delay in the arrival of the vaccine? And my last question is, what are the reasons been given for the delay in the vaccine? Are there political reasons involved? Or are there more practical reasons around maybe a breakdown in manufacturing or whatever? Thank you.
Okay, thank you. I'll just come through some of those. Community pharmacies are all going to operate maybe slightly differently, but the one thing that they will all use is a vaccine management system. So they will be able to put all the information about the individuals who book on with them and into the vaccine management system, so GPs will know who's been vaccinated in that way. We don't expect that GPs will refer, but they certainly can do if they want to. I think people will be booking themselves. I have heard that in some towns, pharmacy practices are working together to deliver the programme, which sounds to me eminently sensible, but clearly they're all independent practices and therefore will make their own decisions about that. So they're working out how they'll do it. I think it's individuals indicate their interest and then they book a slot. I've emphasised before the importance of not wasting vaccine. So they won't open a vial until they know that they've got enough people spaced out, socially distanced through the day to kind of do that. So that's why I think that those first few weeks for them will be careful about how they're operating. They'll iron out all the kinks and gain confidence with that. So they may well change how they do it after that time. But it does allow them a little bit of opportunity to kind of do that. But I've great confidence they will be able to do that. And the second one, about the military being deployed. Yes, we expect within the SSE arena there'll be a number of military who'll be vaccinating there as part of the team. The original date for them to come in was, again, very much aligned to the start of the programme, and we had an opportunity for them to come a little bit earlier, but we declined that because now that with the vaccine supply been a bit less, we didn't need them any earlier than the beginning of the programme. So that is, I think, going to be an important part of the SSE arena programme. And the third, which was the reasons why the delay, well, that supply, the bumper, both the one that we got at the beginning of March and the one we were expecting at the end of March, came from India. And the one that we got at the beginning of the March had a short shelf life of only 2 weeks, which is unusual. So we had to use it very quickly. What we were expecting at the end of March was that another batch would also have a short shelf life, a little bit longer than the first one, so it was to the end of June. And we are now expecting that will come in April. We think these are technical difficulties rather than anything political, and that's what we've been led to believe so far, but I have no further information than that.
Thank you, Patricia.
Thank you, Alan, and thanks, Patricia. I'm going finally to Cara Hunter, and I do want to thank you for Patricia. I know you've stayed a bit over the agreed time, but I appreciate you taking so many questions from members, so thanks for that. So go ahead, Cara, please.
Thank you, Chair, and I will try and be brief as I'm aware of the time. Patricia, thank you again. You're arguably the busiest woman in the country, so just to congratulate you on the good work that you're doing, thank you. I just have a few questions. One of them is around public confidence. I know Northern Ireland has a particular problem with vaccine hesitancy and resistance. I'm just wondering, have you had any conversations with the Health Minister on tackling this and the kind of anti-vaxxers? Also, I saw recently news reports around parents of clinically vulnerable children, and I'm mindful the vaccine was only tested on adults, but for those parents out there, is there any considerations or updates for clinically vulnerable children under 16? Thank you.
Okay, if I go to the vaccine hesitancy, I mean, Northern Ireland, there will be a small number of people who are highly opposed to the vaccine, but a slightly greater number that are more hesitant and anxious for themselves. Where we know that is true within a group, we try to get some good messages out to give them confidence about coming forward, and the Public Health Agency are leading on that. So I do know this is of enormous interest to the Minister, and he will always be asking us about what the plans are around this. So as I said, Public Health Agency are targeting, you'll see some of the kind of messages that are very clearly aimed at younger women, aimed at those who are pregnant, those who are concerned about fertility, etc. So I think they will continue to refine those important communications as we identify where the hesitancy exists. So I think it has to be of concern, I think, to all of us as we're getting towards the later stages of the programme. And the other about the clinically extremely vulnerable children, yes, this is the AstraZeneca vaccine is only approved from 18 years and above. Pfizer is approved from 16 years and above. So we've been able to vaccinate anyone in those age ranges. For any of these vaccines down to 12 years of age, where there is an overriding concern that the paediatrician recommends it, I think it can then be used like any medication. It can be used off-label, and there's a small number where that's been the case, but it is not advised below that age. And I can understand, I think I've seen the same media report that you did, and definitely felt for those parents in that case. But what I am aware is that AstraZeneca has been doing further studies at the moment looking at children, and that we expect to get some kind of report from that by the summertime. And if we do and the advice changes, then we'll open it up for that. I don't think it's likely to be in terms of a wider programme, but maybe just targeted those clinically extremely vulnerable, which is what it is for the 16 to 17-year-olds at the moment.
That's great, Patricia. Thank you for being here. Thank you.
Thank you. Patricia, just in relation to workforce, now I know there were issues at the start around people trying to apply to become vaccinators to support that effort. And I do know of cases where people have become so frustrated that they actually didn't complete the process. But I believe 506 people did complete the application process, of which 170 are now available. Can you tell us when the additional 336 people who have stepped forward to take part and to help with this vaccination programme will be brought into service?
Well, what we've been told, I'm trying to look and see if I've got any kind of notes on this, Chair. I think they've been the training course for them is now reduced to 1 day. So we know that part of it is now quick, which was a slower part before. And we also know that there has been a national protocol enacted that will allow us to look at final year medical and nursing students, and looking at how they will come in to support the vaccination programme. It's really more by way of giving relief to those who are currently vaccinating rather than saying we need additional vaccinators. We do, to allow people to rotate in and out of that service. So I understood that they were all either lined up, many of those already lined up for the SSE arena, and that's where the target had been. Some of those others were released back to trusts to use in their programme. I don't have the exact figures, but I'll get those for you, Chair.
But I'm just wondering if there are 336 people available now to start to go to the trust, to the arena, or whatever, when they are going to be brought and facilitated being brought into service, so we have them, those local feet on the ground.
Yes, well, I think some of them are very definitely going to be part of the workforce of the SSA arena. I'll get the detailed information for you. I don't have it at hand now.
Yes, please do. Yeah, okay. Thank you. Okay, Patricia, listen, I want to wish you and all of your frontline team who are out there working so hard and so effectively in terms of this vaccine, to wish them all the best. They're putting themselves in harm's way in a sense, and I think that's to be welcomed and appreciated. And we want to wish you all the very best, and that the programme continues to deliver the high levels of effectiveness that we have seen to date. And thank you for coming to committee this morning, and all the best for now. Okay.
Thank you very much indeed. Thank you very much indeed.
Okay, members. Thank you. Anything additional there to pick up on before I propose we'll take a very short break before our next session? But is there any comments or that members wish to? No, I think everyone okay in that sense. Okay, thank you. So it is now 10:34. Could we come back at 10:40, members, please, and for resumption at 10:40, just a short break. Thank you.
Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound.
Thank you, and thank you, members. So we're now resuming our meeting this morning, and item 6 is a briefing from the Interim Mental Health Champion. I refer members there to the briefing paper, which is tab 6.1 of your pack, and to copies of the mental health plan and draft mental health strategy at tab 6.2 and 6.3. So I'd now like to welcome Professor Siobhan O'Neill, who is the Interim Mental Health Champion. Good morning, Professor O'Neill. Are you able to hear us okay?
I am all set, Colin. Good morning, everybody. And thank you very much for having me here.
Delighted, we're absolutely delighted. The committee has a particular concern around mental health. We have the whole impact of COVID obviously has an impact on mental health, but also has impacted our work in terms of the amount of work we had to do around COVID. But we have been aware of your appointment and very pleased about that and the work that you've been doing. So we're delighted to hear from you this morning. I also want to welcome with Professor O'Neill, Mr. Peter Cash, who is Senior Policy and Research Officer in the Office of the Mental Health Champion. Peter, are you able to hear us okay?
I am indeed, Chair. Thank you very much for your welcome.
Okay, thank you. So listen, you're both very, very welcome this morning, and without any further ado, I'd like to invite you now, Professor O'Neill, to go ahead and brief our committee, please. Thank you. Thank you.
Okay, so in today's evidence, I'm going to be calling for the development of a trauma-informed recovery plan for Northern Ireland. Now, the phrases that I'm using and the terms trauma-informed, it's about recognising that whilst our well-being can be impacted by our normal emotional responses to what has happened over the past year, for most of us, the pandemic will not have caused trauma or mental illness. However, it recognises also that there are several population groups that have been disproportionately affected and have suffered very real trauma, which comes on the top of previous trauma. And it's these groups that we actually need to target in our preventative interventions and treatments if treatments are necessary. So a trauma-informed approach is completely different from our traditional model of mental illness, which was about really defining what's wrong with us and treating the symptoms of illness. So it's recognising that our well-being and mental health result from our responses to things that have happened to us. So that's a differentiation I want you to try and grasp if you can. So why do we need a trauma-informed recovery plan? So on the one hand, we've got stress. So trauma's on this continuum with stress, and stress is not usually harmful, and the pandemic has caused lots of stress. So trauma is an experience that causes distress because it threatens our life or our personal integrity and overwhelms our ability to cope and causes those feelings of helplessness. So that's really the trauma that I'm talking about. And the effect of that trauma, or even chronic stress where we're living in an intensely stressful situation, is the biological dysregulation. And you'll be familiar with the fight, flight or freeze response. It's our body's reaction. It's inbuilt within us. And the goal of the trauma-informed approaches then is to promote regulation of that, emotional regulation of that biological dysregulation that happens with stress and trauma. With normal stress, it happens and it goes away again. But with chronic stress, we can get stuck up there in a state of dysregulation. And that is the basis of mental health and mental illness. So trauma-informed practice prioritises our physical safety and also our psychological safety, because if we don't feel safe, then we will become dysregulated. It's a source of stress for us. So this is as much about making sure that we don't have any more waves of the virus as anything else, so that we feel physically safe, and then psychologically we feel safe and secure. So the approach that I'm talking about also recognises community neuroscience, this idea that as humans we've evolved to live in social groups, and there are literally parts of our brain that are activated in tandem with the brains of our loved ones, and there are mirror neurons that help us connect with other people and make us feel safe and secure. So the healing from trauma occurs through our attachments to others and families and communities, and psychological safety is promoted through relationships. So you can see there, I'm not talking about applying treatments for an illness. I'm talking about healing through relationships and connection. So in trauma-informed practice, there's no us and them. There's only us, because we're part of this whole community of humans, and we all suffer because other people have suffered, and we heal through our relationships with others. So aspects of trauma-informed approaches would include trustworthiness, transparency, collaboration, real partnerships with service users, equality, empowerment and respect, and all of those things. So it removes that hierarchy. And it means looking after our healthcare providers equally alongside those people that we need to help and support who have mental health difficulties. So trauma-informed approaches also recognise inequality, the trauma of inequality and discrimination, and cultural, historic, gender-related trauma. So in Northern Ireland, this also refers to how we address and discuss issues associated with the conflict, recognising that there are communities and individuals who live in continuing fear and threat, and we need to be very careful not to re-traumatise those individuals through our language, through the way that we address our historic past. So what is the research telling us about the pandemic? So very clearly, the majority of us are not at risk of mental illness. And this is what we would have expected, because most people, even when terrible things happen, very distressing things, we don't develop mental illness. Healing occurs, we cope, we have evolved to be very, very resilient. So phrases like the tsunami of mental illness, those sorts of phrases are not appropriate, because healing and recovery and even growth are likely if we manage recovery very well. The studies show us that particular population groups are at higher risk of having adverse mental health impacts through ongoing dysregulation that's resulting from stress and trauma. And in line with what we know about trauma, these are the groups who are the powerless groups traditionally, who've been carrying the burden of multiple roles and who have a history of trauma and discrimination. They are children, young people, women, people with children at home, and people with existing mental or physical illness, people on very low incomes, and unpaid carers. There's also a mental health risk that comes from the COVID infection itself. So COVID is associated with a higher risk of mental illness, particularly among people with severe infection, those people with long COVID, and people who were hospitalised. And again, that might constitute a trauma for those individuals. We're seeing really high rates of distress and even post-traumatic stress disorder in health and social care workers, and women, again, have a higher risk than men. And the Maternal Mental Health Alliance are concerned about the effects of the stress of the pandemic and the restrictions in hospital visits, and those women that have given birth during the pandemic being at higher risk of postnatal depression. And of course, in keeping with the trauma-informed approach, that's going to impact their relationships with their children. So there's another generation that we need to support by supporting our mothers there too. So turning first to children and young people, the most recent report from the CoSpace study, and that's a study of the UK and Ireland and Northern Ireland and several European countries too. And the February 2021 reports are showing that a third of primary school children, primary school age boys, and a quarter of primary school age girls have problems with hyperactivity or inattention. Again, this reflects that emotional, that dysregulation, the impact of the stress of being separated from their peers and for not having their structures of the school day. In January, the figures showed that 30.8% of secondary school age girls reported emotional problems, and that was compared with 15.6% of boys. And those rates were at the highest rates since last March. So if we can imagine, most of us were on high alert naturally and normally last March, but for most people that's gone way down. But our secondary school age girls are right back up there where they were last March, and that is really, really worrying. There's another review of 27 studies looking at school closures specifically, and the academics involved in that review said that they were associated with considerable harm to health and well-being. There's been a decrease in hospital presentations and even delayed presentations, with children and young people presenting more seriously ill. So, for example, dangerously underweight as a result of restricting their eating. Again, that's a behaviour that people engage in order to try and control the emotional impact of the stress that they're experiencing in order to try and regulate that. There's also concerning increases in screen time and a reduction in physical activity. So physical activity is regulating, and young people are doing less of that. All the studies show that young people in deprived areas and children with special educational needs were at greater risk. Now, we know that children in Northern Ireland have higher rates of mental health problems than in other areas, so it's really important that we now protect our children and young people from any possible further harm. So turning to suicide prevention, there's generally no increase in suicide rates in the Western world, and our surveillance of probable suicides indicates that there's been no rise in Northern Ireland either. Nonetheless, a UK-wide study found that there was an increase in the rates of suicidal thoughts as the pandemic progressed. So that's getting worse. And suicidal thoughts, again, keeping with the trends, they're highest in the youngest age groups. In the 18 to 29 age group in that survey, 12.5% had suicidal thoughts. And it goes right down to 1.9% in the over 60s, 8.4% in that 30 to 59 group. So suicide's related to mental illness, but again, a trauma-informed approach is actually much more appropriate because it recognises the role of life events and overwhelming distress, and this changes how we treat suicidal thoughts. Trauma-informed treatments emphasise relationships, connection, compassion, but also safety planning and problem solving, and treating those mental illnesses if they're there, and looking at all of the aspects of that person's life that led them to that point. Again, people in the lower socioeconomic groups and people with existing mental illness were more likely to have those suicidal thoughts. As I said, the rates of suicidal thoughts increased as the pandemic progressed, and the latest data from the last part of last year shows that defeat, entrapment are starting to increase again, and that's with lockdown, and people are worried about their futures, and particularly in young people, people in lower social and economic groups, women and those with pre-existing mental illness. So my recommendations. So what I'm saying is that healing from trauma is achieved through connections and communities and relationships, and reconnecting, particularly for the groups who were most affected. That should be the primary goal of the recovery plan. The cross-departmental approach to mental health recovery is required because many of the determinants of mental health under that trauma-informed approach, we need that secure base. So housing, employment, debt, social relationships, those are all outside of the remit of the Department of Health. So all of the government departments need to step up here. There are universal interventions that are going to impact on suicide rates and mental health, and those include the financial safety nets and the support for people who have lost income and employment. There's also important public health responses that we need to prioritise around domestic violence, the safe consumption of alcohol, support for people who are facing isolation and entrapment, support for those who are lonely, and support for those who are bereaved. A full, safe return to school is important, emphasising safe for pupils and teachers. If you don't feel safe, you can't co-regulate others. And the emphasis should be on reconnection and regulation through play, art, music, not exams or exam preparation, because that again heightens that stress response and moves away from what we're trying to achieve here. The summer period should also be used for community-based programmes promoting wellbeing and reconnection and regulation. For the general population, we need to emphasise the resilience that has been shown. A narrative which states that we're all going to have mental illness is actually really disempowering, inaccurate and potentially harmful. So we must continue to promote the importance of self-care using the evidence-based Take 5 steps and the support available locally. So that's our campaigns. And emphasise the importance of connection. And I think physical activity is two very simple things which will make a huge difference to the healing process. I would also say we need to promote the value of good food, sleep and exercise. Getting all those physical things right will put us in a better position to heal psychologically. So funding does need to be made available to increase the capacity of mental health services to provide treatments for depression and anxiety for those who need them. So people will tip over into those thresholds for mental illness. It's really important that we provide treatments. The crisis intervention services need to be improved very, very urgently so that people who are suicidal have compassionate support and interventions for safety planning and problem solving. And there shouldn't be waiting times, but it's about that continuous support, almost like within the next 48 hours after someone feels suicidal. It's vital that we look after our healthcare staff, of course, and that needs to include informal and unpaid carers because they're part of the workforce and we need to support them in the same way that we support all our other healthcare providers. There needs to be compassionate outreach to those groups who have experienced higher levels of trauma and loss. Not necessarily applying treatments, but we need to let them know that we are there for them and ready to respond if they develop symptoms or illnesses or if they feel that they can't cope. And this includes health and social care workers and people working in funeral services and people working in care homes. We also need outreach to people who've been hospitalised due to the COVID virus, people with symptoms of long COVID, and people who have been pregnant or given birth at the time of the pandemic. The budget for mental health services needs to be increased commensurate with the increased rates of pre-pandemic mental illness and the evidence of more severe and chronic mental illness. And then we need to add on our 20% at least, the increase that we're expecting resulting from the pandemic. When we're expanding mental health services, we really need to address the inequalities in the provision and access for LGBT people, for people from BAME groups, for older people and people at risk of abuse and violence. Because again, those are the groups that are powerless, at higher risk and have problems accessing services. We need to make plans now for a programme of events and actions to memorialise and remember those we have lost to COVID, particularly where that loss has been disproportionate, such as in care homes. So bereavement and grief cause distress, but the healing is not through mental illness treatments. The healing is through connection, memorialising and supporting people through that grief process. Finally, you'll be glad to know, it's important to note that these transitions that we're seeing right now is sort of moving into the post-pandemic time, and we're trying to reconnect, and that may actually increase anxiety for people too. And there's a stigma around that as well, but we need to acknowledge that and empower people to adjust in a spirit of hope. The support should be provided for organisations like schools and health and care services and businesses to adopt trauma-informed approaches to engender a sense of psychological safety as we approach the end of lockdown. So I would be delighted to take your questions now on that. I look forward to hearing from you.
Okay, thank you, Siobhan. And I have to say, well, I suppose just from the outset, I should actually declare my own interest in terms of having worked as a social worker, and indeed worked in family and in at a community level, but also having had the benefit of some of the training around the whole trauma-informed approach. And I think that's an excellent model to use. And there's so much, like, not only was it a fantastic presentation, I have to say, but I think a really, really important presentation for all of our political institutions, for the executive. That whole idea about having to deal with these inequalities, not simply because they're a problem in themselves, but because they also feed out into difficulties throughout our whole society. So, you know, dealing with inequalities will also help your economy, if you want to even just look at it as, you know, so you're dealing with economic inactivity, you're dealing with that community type of response. So I think it's really interesting. I also had a particular interest when I was working in social work around that area of transgenerational trauma, and you touched upon that in relation to the next generation. But also we need to recognise we're still carrying some of the transgenerational trauma from the conflict into what's happening now, and I think that's vital that's recognised, and I think that approach would be a game changer in the sense of a more holistic approach to mental health generally. It struck me just in general terms as well, in terms of the people who are more vulnerable to mental ill health, are largely unpaid carers. Those on lower incomes are less well off. In eating disorder and in terms of hyperactivity, and it struck me throughout that how many of those areas are also predominantly women. And I think that's something that we need to really get to grips with. And I became aware recently that actually girls struggle to get a diagnosis as quickly as boys, because sometimes their behaviours don't show up in a way that draw attention to them, and that's another issue. So I think those are really useful ways to look at it. I think this is going to have to be a cross-departmental, a whole society approach to dealing with all of this, and I very much welcome the fact that you have highlighted that as a way forward. Just a couple of questions specifically from me, and then I'll go on to members. I'm keen to know sort of what level of communication you have with the department in relation to mental health regulations, which we in committee here deal with on throughout the pandemic, specific regulations to do with. And one of those has been looking at a particular regulation that extends the period of time which must elapse for a second opinion to be required for the continued administration of medicines to detain patients, and that went from 3 to 6 months. Now, we had expressed some concern as a committee in relation to that, and indeed we do very much welcome the fact that the Minister has now written indicating that he's reversing that amendment. But we have highlighted with the department that we would be keen that they would consult with the like of yourselves, with the like of the Human Rights Commission when considering those regulations. So I just want to check with you what sort of level of contact you would have in relation to drafting or formulating these types of regulations.
Yeah, it's a good question, Colin. The department wrote to me when they were considering changing those regulations and asked me to review what they were proposing, and we provided a response to that and felt, of course, you know, it's disappointing that these things have to happen, but broadly, you know, we felt that it was probably necessary and supported the department in relation to that. But they do write to us on those sorts of issues.
Okay. Thank you. And then in relation to the good summer well-being, and I recognise much of what you're saying around children, and I think we all do share your concern around children, the impact of this pandemic, on top of all the other things they were struggling with, and the need to allow children to be children, just at times and to try to proactively repair some of the damage that has doubtless been caused. through the summer months when the opportunity might allow. So I'm wondering how that's planned on being rolled out, that Good Summer Wellbeing Programme. Will it be down to community level? Because I think that also feeds into building the ability and resilience of community groups to deal with some of these issues if they're involved in that. So can you tell us a little more about that, please?
Absolutely. There's a range of community groups who are already providing and planning their activities right now. So we're trying to connect those up to make sure that they're properly supported. The other thing we're doing is we're working with the Public Health Agency to develop a programme that will be available to all children and young people in Northern Ireland. So we have like Plan A, Plan B, Plan C, depending on where we are in terms of the restrictions as well. But I would be very hopeful at this stage that there will be something for every child in Northern Ireland, albeit it might end up having to be virtual if we don't have a full reopening there and we can't do face-to-face provision, but we're working. We've had very positive responses actually from all of the departments. I feel quite strongly that it needs to be away from the educational setting because the temptation will always be there to focus on the schoolwork and where children are in relation to their schoolwork. And whilst we need to reassure children and young people because they're worried about this too, we need to face this down and say, well, we need to make them aware of the fact that we're going to address that, but we need to give them some time out. And we all know what the benefit of time off is and a real break. We need to give children a real break this summer. To play, to regulate, to do all those things. And adults too need to do this. Art, music, culture, dance, drama, sport, also important to help to improve our mental health, to improve our well-being.
Yeah, thank you. Okay, and finally from me then, in relation to my own previous experience, I was often struck by how many of the cases we were dealing with that had what were known as that triangle of trauma, where you had within a family addictions, potentially domestic violence, and I welcome the fact, and I think we all do, that we're trying to do better on the domestic violence, coercion, and all of that, and abuse. And I think the trauma-informed approach to that, it's a crucial element of the trauma impact. The fact that repeated traumas have a kind of the build-up, the whole plasticity of the brain, especially young brains, and the cortisol and the hormones that are released, even in potentially low enough levels of tension. But if that's repeated, then that starts to form patterns. So are there any plans to kind of roll out that awareness, at least in the first instance, of the impact of trauma and how frontline professionals beyond health might be able to recognise and deal and support, address issues and support children in a trauma? Is that part of your planning at this stage?
We were all familiar with that sort of perception of walking on eggshells and how enormously stressful that can be in the long term. And we pick up subtle cues when the people who are around us are stressed or under pressure, when things are not quite right, So you're right. It's about that underlying stuff as well as the more overt externalizing behaviours that, hurt people like that. That's the adage that applies to this. So what I'm doing through another project called Our Generation, and this is a European funded project through the university, is rolling out trauma-informed interventions for children and young people in deprived and border areas. And we've got training then that will be rolling out on a more broad basis. The Safeguarding Board for Northern Ireland are rolling out trauma-informed practice training as well. And there's also the MACE project, which has been successfully delivering training in trauma-informed practice. There's so much actually available free on YouTube if anybody wants to start Googling this, but it really is a game changer. So the work of Karen Treisman, Gabor Mate, those are the key people that you can get some really good talks. The Action Trauma do a trauma conference, a trauma summit every year, and again, some of that material's available online for free for everybody to have a little look at.
Okay, thank you. So listen, I'm going to go across now to members. I'm going to go first of all to our Leah Flynn, then Pam Cameron, Jerry Carroll, Carol Nichillen, Cara Hunter and Paula Bradshaw. That's the order I have there at present. So I'll go first of all to you, Orlia. Go ahead, please.
Thank you, Colin, and thanks, Siobhan, for your presentation today. I know that we met last week, and we've probably covered everything that I've wanted to cover with you already at this stage, but I appreciate you coming to today's committee, and that was really interesting overview there around that trauma-informed approach. So just maybe to focus on that then, obviously that's going to take intervention and commitment from across all the departments, as you said, but how will this recovery plan, I suppose, interlink with the mental health action plan, where the Department of Health, so with the Department of Health specifically, and what their remit and roles and responsibilities are to deal with the mental health problems in our society? How will that trauma-informed recovery plan interlink with the mental health action plan? And I would be interested to know, I know that there has been some investment in the COVID-19 section of that action plan around the psychological talk and therapy, some additional nurses. But in your opinion, do you think that that's enough? And what would be the key, the sort of 2 or 3 key priorities for you at the moment, that from a departmental health perspective, that we need to invest in for mental health? Thank you.
Okay, thank you, Julia. Great questions again. And so how will the action plan fit within the trauma-informed recovery plan? Well, the action plan is around mental health services and the messages, I think, that we've sent out around mental health, and also about suicide prevention. So the action plan is about helping those people who are meeting the threshold for mental illness, basically meeting they've had trauma, distress, but their symptoms are ongoing. So the period of time that the nature of the symptoms determines whether or not someone's eligible for a treatment, or whether somebody needs a treatment. And if you try and apply treatments where people don't need them, you actually create more distress, because you're telling someone they're unwell, So that's very important. So this is not really about counselling upon request or counselling upon demand. And actually those reconnections within families and communities are healing, and they promote resilience, and they can even promote post-traumatic growth, But where someone has a mental illness that can be diagnosed there, it's about making sure that they get prompt treatment, so the right treatment at the right time. And that's where the mental health strategy is really, really strong. So there's early intervention. We tackle the symptoms. We teach people how to self-manage and how to take control over their well-being. And that's so empowering and important. We teach people about the importance of those relationships that we have with our children particularly, but across communities. But then when someone has a mental illness, we give them the treatments that the evidence tells us will really work. So the mental health strategy is the plan to deliver all of those treatments. The 2 priorities, and you asked for key priorities, I think one is crisis intervention. Crisis intervention is about recognizing that people are in a state of distress, that they might become suicidal, and it's providing compassionate support straight away there, and continuous support. So I know the crisis intervention services are being reviewed right now. That review should be reporting very, very soon, and then we should be prioritising turning around those services. Now, there are great services that exist at the minute, so it's probably going to be about building on those services, but the importance is that it's continuous, that it's not just a one-off intervention, that we do these safety plan and interventions with people who are suicidal. So you'll have seen maybe the documentaries on over the past couple of days about when someone gets very suicidal, the thoughts can come really, really strong, and then they can reduce a bit. So it's helping people manage those thoughts and problem solve and work out ways of changing their lives so that they don't feel suicidal anymore. So crisis intervention services for me are a priority. Dual diagnosis services, and we spoke about this on the radio yesterday earlier as well. People who are using substances, again, under a trauma-informed approach, we would be saying that this is a natural way that we have of coping with stress. This could be any one of us, but whenever we're distressed, we can become dependent on substances. But it's about recognizing that there are underlying traumas, maybe even underlying mental illnesses, and they all come together, and we need to be able to provide a service that helps people manage and navigate all of those. So we're not trying to box people off into either addiction or mental health, but we have something that's provided to address both. So those are key priorities. I think eating disorders too. given that figure, 1 in 6 young people here are engaging in disordered eating, again, as a way of controlling their emotional response to trauma, stress, pressure, chronic anxiety, whatever it is, a way of controlling things, but it's a really dangerous pattern. So those eating disorder services, getting in there earlier would be a priority for me. But if you look through the list of actions in the mental health strategy, there's very little there that isn't a priority. So it's about, it's thinking about, well, where are we losing people? And that's with the crisis intervention services and dual diagnosis, where there are people actually dying, so that's huge.
Yeah, thank you. And I fully agree with those priorities and those comments, Siobhan. And I think that, even the role that you've taken up as the mental health champion, even the fact that you did have the opportunity to take part in that interview yesterday around a family who's been bereaved as a result of a young man that was battling with addiction and mental health. So I think for that, I'm hoping that your role is a comfort to families out there who are struggling with these really difficult issues. And maybe just to finish then, Siobhan, you had mentioned then some of the at-risk groups. And, we hear time and time again about, the issue around health inequalities, areas of deprivation, people that are obviously falling within that lower socio-economic group. And I'm just wondering then, in terms of the budget, because we do know, and we have raised this with the Minister, that the percentage share of the budget does need to be increased for mental health. So would you agree that it might be a sensible approach to try and, almost ring fence or target some of that funding towards those at-risk groups? And the final point was the issue around the psychological helplines for health and social care staff, because I know that they fall into that bracket. We did get feedback from Charlotte McCardle, the Chief Nursing Officer, that there hasn't been a great uptake on those helplines, and just maybe your view on that. And that's everything from me. Thanks very much.
Okay, well, I need to make notes for everything, aren't sorry, because I forget parts of sentences. So yeah, funding for at-risk groups, allocating funding. There is merit in that argument, certainly, but we can't forget the early intervention and prevention too. And again, there are universal things that we can do that mightn't cost a lot of money, like our summer programs that will actually lift everybody, and as long as we make sure that they're accessible to the at-risk groups, then, that's good as well. But certainly there's an argument there for actually ring fencing funding for those at-risk groups. And prioritising that. But, the 10-year strategy is required because we need to see how that fits within an overall plan. The last thing you want to do is start to develop a service and then find you have to change it again, and that's going to cost you more. So that's really why, and this is a really hard part of my job, is trying to explain to bereaved people, to people who are on waiting lists, why it's 10 years, why we can't just do it straight away, but we need to move really quickly. We do, and I know the Minister is committed to turning around the final version of the strategy straight away so that we can get moving. So it's going to be a few weeks yet before we start to see the actions in the final version, and that's no comfort to the bereaved, and that's where we are, unfortunately.
Okay. Thank you, Arlea. Is that it, Arlea, there for you?
Yeah, it was just a wee point on the psychological helpline, Siobhan, about the health.
Totally forgot. Yeah, I mean, and that's why the compassionate outreach is so important. So we need to find out, well, why is that happening? We know people are struggling and suffering. So what is it, and again, we know this, the need is there. But the other thing is we shouldn't be pushing help on people, because people do recover and they're more empowered when they do that and they feel stronger, so it's not about giving people treatment that they don't need. The other thing we could do very clearly is extend the remit for those helplines to unpaid carers. We know they're suffering, and we sent a letter to that effect so that we could try and have carers access those services, because there are many carers who do want and need services straight away. But we need to be providing the respite care there and supporting them so that they don't develop mental health problems. It's not just about providing treatments when somebody gets ill. So I don't want prevention and intervention to be forgotten here, because it's much, much cheaper to provide respite and to provide that recognition of carers as part of the health service, which they really are, but they don't feel like that at the minute. They've been largely forgotten about in this pandemic, and that's not good enough.
Okay. Thank you, Arlea, and thank you, on. So going into our Deputy Chair, Pam Cameron. Go ahead, Pam, please.
Thanks, Chair, and thank you, Professor O'Neill. Really do appreciate your attendance at the committee, and thank you for a very detailed briefing this morning. And the 20 recommendations obviously will pose a challenge to both the Health Department and to all the departments across the board, and I think that's appropriate. Also want to thank you as well for raising that issue around the language that we use. I think that's really important, something I hadn't fully appreciated, the fact that, it's well, we all have mental health, but we don't all have mental illness. So we need to be careful that we are not kind of throwing words around us that they're actually causing more distress and more fear as well. So thank you for that. My questions, Siobhan, recommendation 20 proposes that the trauma-centred approaches should be at the heart of schools, health services, businesses moving forward. How can we take that work forward in a practical way in order to ingrain this culture within those organisations? That's my first question, then I have another one.
Okay, one question at a time was great. Thanks, Pam. That suits me very well. So how do we do that? Well, we just encourage employers. We raise awareness, I think, of the importance of psychological safety and of real safety. So we need to, again, make sure that employers are aware of what restrictions are in place at any particular time and that they're protecting their staff. So staff feel that if they need to come into work on a face-to-face basis, that they are safe. That flexibility that employers have shown the whole way through the pandemic has been brilliant. So we need to see how we can continue with that, particularly, again, for those groups, people with children at home, women, people who are carers, all of those groups, that we offer them that flexibility and that sort of compassion, just saying, I know it's been a hard year, so we're going to take this easy and we're going to support you and we're going to listen to what you want. It's also about employers looking after their own mental health and well-being as well, so that they're well regulated and they're in a position to really see and understand what the needs of their staff are as we re-emerge for this. And that transparency is so important, that principle of transparency, where you give people information. So there'll be a lot of companies and staff now who are thinking, my job's at risk, I want to know where we are in terms of profits and how we're going to cope after furlough ends and all that stuff. So that transparency and information sharing is absolutely crucial. But a well-regulated boss can then come in and problem solve with staff and help work out how we can meet everybody's needs there. So those are the key messages. It's actually quite simple, but those hierarchical structures where we don't treat people well, where we don't listen to what people need, that can be very, it can be very harmful right now.
Okay, thank you. My second question, Siobhan, is around, and Orlia touched on deprivation, but I wanted you to, if you could, for us, just to give us a better understanding of what this means, and explain to us how deprivation leads to increased risk of mental illness. Is it linked to having a stake in education or employment, or are there intergenerational factors?
It's everything. So living in deprivation, that could mean that your housing is less than adequate. It could mean that your income is reduced. Both of those things reduce your sense of safety and that sense that everything's going to be okay. If you're constantly worried that you're going to be made homeless, that is a constant fear. If you're constantly worried that you're not going to have enough money to put food on the table or pay your bills or keep your house warm, then nothing else is right. If you're worried about those sorts of things. So it's about the psychological safety. It's also in Northern Ireland about recognising that there are generational effects here, that parents, whenever they're in that state of constant fear, that they're not able to relate to their children as well, and they can create adversities for their children as a result of that, which impacts then on their children's mental health. So it's that walking on eggshells idea. It's living your life in fear that you're not going to have enough, that your children won't have enough, that you won't be able to clothe them, that you won't be able to do the basic things that you need. So that's really what deprivation is. It's also that lack of hope, maybe, that you feel that you don't have a stake in education, that your children won't have the hope of getting a really good job and really contributing to the economy and having a meaningful life and all of those things. So it's about perception as well as everything else. But if you can give people safety, security, like a basic income that they can survive, they will be much more content, and they will be less likely then to develop mental health problems or even externalizing manifestations of that emotional dysregulation. That's social violence we're talking about, really. That's when people get angry and they get in the streets and they cause difficulties for themselves and others. But again, it's all about that internal fear and anxiety that's just all their life. That's part of their world. It's part of their life. A lot of us don't even recognize it. If we're living in a situation of privilege, we've no idea, we've no clue what that's like.
Absolutely. Siobhan, I just want to thank you, because you explain things so easily. I could quite happily listen to you all day, because you have a very sensible, clear approach to explaining your thoughts and whatnot. So thank you very much. Thanks, Chair.
Okay, thank you, Pam. And going across then to Jerry Carroll. Jerry, go ahead, please.
Thanks, Chair. Thanks, Siobhan, for your presentation and all your very, very important and valuable work. Thanks for that. I'll try to do one at a time, so I don't know how much time I have to ask questions, Siobhan, so bear with me as long as you can. I like your focus on sort of building communities and relationships sort of in the aftermath of COVID. I think that was very, very important, and your emphasis on trustworthiness and transparency in terms of services and information that people get, I think is very, very crucial. I just wanted to sort of get your thoughts on the idea or the suggestion that we might be, solely or primarily focus on a pharmaceutical or medicinal focus on tackling mental health illness or issues. I mean, obviously, goes without saying, medicine can provide important use for people who are severely distressed or whatever the case may be. But I've seen one report to suggest that there's in one avenue there's 3 times more spent on antidepressants than there is on counselling. So do you feel that there's an over medication focus on this issue, and there should be more of a focus on the likes of communities and relationship building, as you suggested?
Well, yeah, of course, that's naturally what I'm suggesting. The response, the healing occurs through relationships, through communities, through connection, through regulating activities. Medication can help with that, and it's been really, really useful for people. And many of us know, how powerful an antidepressant can be, but it takes a number of weeks to work. It stabilizes your mood, but there are side effects with that as well for many people, and they only work in this, in a proportion of the time. Sometimes they don't work, sometimes they make things work. So, the answer is not really through medication, but it can be helpful as part of a program of work, of therapy, really. The nice recommendations are that medications used in conjunction with counselling, with talking therapies. So that should be provided. But unfortunately, we don't have enough counsellors, we don't have enough psychologists trained, and the workforce planning issue is there as well. And that's why we need a mental health strategy that goes over 10 years, so we can start to make sure that all the talking therapists are there. So that's why we need to move on this strategy. The increase in antidepressants hasn't been as big, though, as I expected, Jerry, I have to say. It seems to be there's an increase in the cost now, and that's something we do need to look at, because are the pharmaceutical companies charging more? Who's benefiting from this? Who's making money out of this? But yeah, medication absolutely has its place and can help, particularly in the short term. It can be really, really helpful, but it's not going to change underlying problems. When I talk about safety planning, problem solving, those kind of things, emotional regulation, medication is not a quick fix. But the other medication that people use is alcohol. Lots of people are already using alcohol as a way of self-medicating. We know the regulating effect of alcohol, it calms us down, but then over the long term, there's a flip side of that too. So chemicals work, but exercise works, connecting really, really works. There's lots of other things that work too, which we'd like to try. And people want that as well, so So we need to broaden the availability of talking therapies. That's in the strategy. It's urgent. It is urgent too, but we need to train people to be able to do it as well.
Thanks, Siobhan. I'll just do a couple of quick fire questions and let you answer them as best as you can. I think the mental health strategy.
Jerry, just like we do have a little bit more time with Siobhan than we did with so I want members to know that we hopefully can spend a little bit more time. So don't be rushing it needlessly. I don't want members to filibuster all the way to close of play, but hopefully we'll have a little bit more time with Siobhan this morning.
Thanks, Colin. Thanks, Siobhan. Normally we are rushing, so it's good to have a bit more time. So I'll not overegg it, but I'll take a bit of time. Thanks, Siobhan. The mental health strategy, I raised this with the Minister a few weeks ago, doesn't address the fact that there's a lack of in-house counselling services in GPs. My own constituency in West Belfast, 50% of GP services don't have any in-house mental health counselling services. So that's very, very concerning, and wondered if you have any comment and view on that. The other concern I have is the CAMHS waiting list. I put in an assembly question. I think it's 1,600 or approximately that number, 1,600 people waiting on a first appointment with CAMHS. So I'm kind of concerned about the effect and the ability for people to be seen when they need to be, but also when they can be after the pandemic, whether there'll be enough resources for them. And then just finally, I think the point around the summer is very important. I'm glad you raised it, because I'm concerned that there's an approach that basically says pupils missed a lot of school time, which they obviously did in the last year, but the solution is force them back into school in the middle of summer. Not really for any focus on well-being, but primarily because education is focused towards exams and, in many cases, pleasing adults rather than benefiting young people. So I hope that is an approach where people are forced back in the classrooms and schools when they really should be out, socialising with their peers. So any comments on that would be great. Thank you.
Okay, so let's take counselling in GP practices. There's a number of really successful models where counsellors are in-house in GP practices, and that's great. And I would want to see that included in the strategy, because at the minute it's not really. But the main model that's been used is this idea of a psychological therapy hub, and that again, the important thing for me is that people have access through their GPs, and that it's close. They don't have to get 10 buses to get to their appointment, that it's available at a time that suits them. So if they're working during the day or if they have childcare responsibilities, it can be flexible. So all of these things are really important, and we need to make sure that it's accessible within a very short waiting time. And PPR's target of 28 days, I think, is spot on the mark. It should be around that. That's a reasonable time for somebody who's not an urgent need. Obviously, crisis intervention services are different, but some of the GP federations and GPs are telling us that they don't have the accommodation and the practice, and that they would typically refer to the psychological therapy hubs or the community and voluntary sector services locally, which works for them. So I would be in favour of this sort of blended approach, but the important thing is that everybody has access to talking therapy within a couple of weeks from their GP. And even a GP appointment can be really hard to get as well. The other element of this is that there's multidisciplinary teams now in many GP practices where there's a worker there designated to see people who are coming with mental health issues and help triage them and work out what the best service is for them. And I think that's a really important development. But it's again about bringing it right into the community, making sure that people can go to somewhere that's familiar and access a therapy or counselling in a timely way that meets their needs, without having to travel away or sit in waiting lists for ages, because people get worse when they're in waiting lists, and it sends that message that there's nothing we can do here and our services are poor. And actually there are some really great services, and the potential is huge to deliver really good services for people if we implement the strategy fully. Which also touches on your question on the CAMHS waiting list. That's far too long. We know that if you get in there early for children and young people, that you can make a real difference and turn things around. Mental illness impacts and educational outcomes, it impacts and everything. So we need to be much more prompt there. A lot of the trusts are moving forward, and again, when the referrals come in, they're trying to prioritise the really urgent ones. So that means the waiting list. The pandemic hasn't helped, but if you look at the mental health strategy, there's actions in there, and these are priorities because of the preventative element. So you have a young person now who may need a dual diagnosis service in 10 years' time if they don't get prompt mental health treatment. So it really is cost effective to prioritise those younger age groups. In terms of the summer and children in schools, it is absolutely biologically impossible to learn when you're in that state of anxiety, when you're dysregulated. I know what it was like trying to prepare lectures around that time when the lockdown happened. I couldn't focus. I couldn't do anything. If you're really tired, you can't work. We all have experience of this. So we should not be expecting our children to come right back into school to start exams again. And it's not going to be possible anyway, because they want to talk and connect with their friends. They'll be jittery. They'll be, all of those behavioural things that kids do whenever they're a bit dysregulated and a bit anxious and a bit nervous. So, it makes sense to prioritise emotional regulation and to do all those connecting things. But I very much fear that it's not happening. And the reports anecdotally that I'm hearing is it's about getting the kids back. And actually, they've more exams to do now because it's spread out, because we don't want to hit them with those sort of single exams. I don't know what the answer is, but I think there's a big conversation needs to happen around education generally, and I'm hoping the review that's going to be commencing shortly will go some way to address that.
Thanks, Siobhan. Thank you very much for that.
Thank you, Jerry. So I have now, in the following order, I'm going to Carol Nichillen, then Cara Hunter, and then Paula Bradshaw. So go ahead, Carol, please.
Thank you, Chair, and thank you, Siobhan and Peter, this morning. Siobhan, you did rightly mention the primary talking therapies and the hubs. But yesterday and last night, I was dealing with groups within the community and voluntary sector who have had their contracts awarded by the trust with up to a 40% reduction. And that's really, really concerning. And then the other issue is that their insurance doesn't cover them around cybersecurity. And these are the people, in my opinion, who are frontline, have been frontline throughout this pandemic, and I'm really, really concerned about that. I also have raised this and will be raising it again. I've raised it with the trust. But can you just, within the mental health strategy, talk about the importance of the primary talking therapies, because we are going to look at chemical solutions. We are going to look at the adverse impacts of poor mental health. And the fact that these vital, in my opinion, life-saving services in our community, who I've referred many to, I would see this as a really, really retrograde step. So that would be my first question.
I have to agree with you, Carol. It's awful. We know that the community and voluntary sector have been picking up the pieces in the pandemic. They really, really have. And it's exactly the opposite of the kind of thing that I'm calling for. So we need to understand why it's happening and what we can do about it. Because it's, the work they do, the links with the community, it's from the ground up. It's everything that's right about this. And it will save money in the long term if we invest in those services right now. So, Peter's here with me today, and we'll chat about this later and get some more information. We've also received your correspondence around the insurance issue, and we're addressing that. Peter, do you want to come in there on that, or has there been any response yet about what we can do there?
We're still looking into it, Siobhan. At the minute, we're trying to see what options are available to us.
Okay.
it's a sticking point, like, but we're aware of that issue. I wasn't aware of the 40% reduction in services. You know, it's just going to cost us more, and we're all going to suffer if we don't do this right. That's the whole point I'm making. You know, so I'm with you on this, and I'm very idealistic, but you hear stuff like this, and it does make you despair sometimes. So we'll have a look at it, and let's get together soon as well, Carol, to talk it through a wee bit more if we can.
No, listen, I appreciate that. It's just that I would say the first time in a whole year of this pandemic, I felt really sad listening to people who had our backs, our families' backs, everybody's families' backs, when above and beyond, working with health and social care staff, sitting in the car park with them before they put their scrubs and PPE on, you know, telling them it's okay, people who were absolutely petrified getting into work. And this is how they were treated. I just felt horrendous for them. And I felt like, you know, they've been let down badly. But I also am determined, like all members of this committee, to ensure we get them supported, Siobhan. And Peter, the other questions I would have is this, and Leah has rightly, you know, and yourself have been very, very proactive and positive on the dual diagnosis in the mental health services. But I am really fearful that when we met with some members of Belfast Trust and Mental Health team, and even correspondence from the Minister, there is no intention or vision to look at after hours or after hours services, even using the community and voluntary sector. And that's alarming. And then the other issue, Siobhan, is, and I'll finish in this column because I know you've been really flexible. I've recently worked with some of the people who have been impacted by the neurology debacle, and they are re-traumatised as a result of, in my opinion, very professional reporting in the Irish news, but they really are re-traumatised. And I'm just wondering how we can help those people, because they're going to everybody for support, and while people are acknowledging their pain, I just don't know practically what we can do to get them more answers from the likes of the department and indeed the trust. So I'll leave it at that. Thank you.
Okay, so the first point is about out of hours services. Really, really important, because that's the crisis that we're talking about that leads people to hopelessness and suicidal behaviour and all the rest. And the review of, I could come back to the review of crisis intervention services, but I would be very hopeful that will be that out of hours contact, but continuous contacts with it's not just a one-off service, and then it will be linked and networked into the mental health services. The group who are working on this, Rory O'Connor's part of that group, and they've designed DBI Scotland, Distress Brief Intervention Scotland, and they provide 14 days of continuous follow-up, and they link people with mental health services and do the safety. So I would be hopeful that whenever we're reviewing crisis intervention services, that would cover some of this. But I constantly my eye on this one, because this is the group of people who are very prone to suicidal thoughts and behaviours, and that's when these thoughts come and when the behaviours happen. So we need to get this right. So absolutely understand your concern there, but April is, and we're nearly in April, so April's the kind of deadline for that review to happen. So let's keep an eye on it. Again, it can't come soon enough. People are suffering right now. Last night, today, like there are people maybe watching this who are struggling, and that's what I'm conscious of as well. In terms of the neurology recall, we've met with that group a couple of times. We haven't heard the reports about the media, but we do know that how the media talk about any issue when it relates to mental health really can re-traumatise. And a trauma-informed approach is about those public conversations, how we talk about people, how we talk about people who are suffering and continue to suffer. So there's a bit of awareness raising there that we can do, and there's some good guidance around how. Yeah, go on.
It wasn't a bad reporting in the media. What happened was the consultant who was there to investigate Dr. Watts is now under investigation by the GMC, and the media were just reporting that investigation. So it wasn't like, to be fair, that they haven't followed the guidelines. If anything, they reported what the families approached them with, just to be clear on that.
Okay. Sorry, I'm not across this, Carol. That's, oh my goodness. So what you're talking about is a group of people who've been injured once and then they find this. That's horrendous. And again, it's going to cause distress. I think distress is a very normal reaction to that kind of thing. I wouldn't be surprised if it did. We have a meeting coming up with the Belfast Trust to discuss how we support this group of people, and that's what we requested, so we'll keep them informed as well about any support that we can provide. Again, it's not even necessarily providing treatments for a mental illness, but it's just knowing that there are people there who care and can listen to them and can help them if they do need further treatments. But that's understandably just so distressing. Your heart would go out to them.
Yeah, no, we must be really careful how we engage and how we protect and support victims across these entire range of scandals which are out there and subject of inquiries. So I agree with that. Okay, thank you for that. I'm going to go across then to Ciara Hunter. Go ahead there, Ciara, please.
Thank you, Chair, and thank you so much, Yvonne, for your time. Your work's absolutely crucial, and I agree with Pam's comments earlier. You always break it down in such an easy and digestible way, so thank you. Being an MLA for a rural constituency, my first question is just around those rural barriers to access for mental health support. I know we've seen some really good initiatives such as the Farm Families Health Checks programme and kind of outreaching into those rural areas and accessing kind of those groups like farmers that wouldn't traditionally have the time or would want to come forward. So I'm just wondering if you could detail any information on that or any kind of updates around it. Thank you.
Thanks, Cara. And as a rural dweller myself, I am so acutely aware of the needs of this population. This is where we need that cross-departmental approach, really, isn't it? Because what's happening with Project Stratum influences whether I can do meetings. I'm on different 4G things here. So the Wi-Fi, the broadband, all of that is crucial. And making sure that people aren't isolated, because isolation then is stressful. And when a lot of things are going online like this, people benefit, but other people, if you don't have the connectivity or if you can't afford to pay for data, that's a problem. So all of these things are things that health services need to be conscious of that as well, and need to be providing devices and equipment and data if that's necessary for people to connect with services. But a lot of the most powerful things that are done for mental health and wellbeing in rural communities are those communities group, those the groups that dial, that ring you every morning, that ring people who are isolated and connect and talk to people and make sure, and local councils, what they do with their play parks. I mean, I spent the last 2 days in play parks with my wee one, and it's just so important for their well-being as well. So I think there's a cross-departmental thing that has to happen here. I met with Minister Putz, and he's very, very interested in rural mental health, and farmers' mental health, but also in the women in those families, because they're at high risk as well of being isolated, particularly if they don't have that work, the kind of connection and the face-to-face stuff that happens through work. So they can feel very, very isolated. So he's bringing forward a range of programs there, and the farm health checks as part of that, but including a little mental health and wellbeing check in there. Not, again, the message is not to say that you're all mentally ill. Most of us really aren't, but getting across those 5 steps to wellbeing and letting people know if they're secretly struggling, if they're feeling suicidal, that there's a lot of support and help for them if that's where they are. So yeah, a lot of stuff happening, cross-departmental approach, but improving infrastructure and Wi-Fi, broadband, all that is part of mental health too.
Thank you. That's such a great answer. I think when you touch on the cross-departmental approach, I think one thing I'm hearing from students and from young people, and it's interesting, you had talked about that age group, 18 to 29. There's a real, problem with accessing jobs at the moment. There's not many part-time jobs, full-time jobs. And then there's that shame and stigma of, you've just got your degree and perhaps you have to go to the dole and all these kinds of, it's a really difficult part in their life. They've just got a degree. It's been a high. And then now, lack of available jobs has just been a big issue. It's definitely coming through my office. Just around that group again of 18 to 29. I know we had talked previously about the important role things like sports clubs can play, local GAA clubs, football clubs, cricket clubs, and really tapping into especially young men and those groups as well that don't tend to come forward to seek help. I'm just wondering if you've had any kind of conversations with them around champion mental health on the ground, and then again that ties into the rural aspect of it as well, I suppose. Thank you.
Yeah, again, Cara, really, really good point. Those community organisations are crucial. We met with Ulster GAA, Ulster Rugby, and the IFA. And we talked about, we're planning on making a sport NI to try and bring them all together to do something kind of across all the organisations and to bring in more women organisations too, because, sport's important for women, but there's just such a dip and a decline after primary school in girls' participation in sport. But it's so powerful being part of that team. Those team sports, like that is the connection. That's the connection that we're talking about, that are healing, that are therapeutic, that make you feel good about yourself, that make you feel part of something. So they're all doing really great work, and they all have great campaigns where they're training people at club level to be those compassionate connectors, to reach out, to help support people with mental health problems, and for anybody that might be struggling with suicidal thoughts to get them the support that they need. So those organisations are running champions, and I want to see champions everywhere, mental health champions like that. That's the vision. But they're already doing a lot of this work. So it's for me about telling people in rural areas, get connected with your local clubs, find out what's there. There's lots of things there, but of course we withdraw. When we feel lonely and when we're scared, we withdraw because that's a fear response. So getting the message out about what's available, and getting the support, making sure that we don't take money away or resources away from those groups, and that we mobilise so that we get them all together and use the people that we have in those community groups to the best way that we can, so we all win.
Yeah, definitely. Local conversations I've had, with Owen Road being my local club, and then Corian FC, it's kind of expanding the conversation with health and, improving well-being and that kind of holistic approach. It's not just about fitness, it's about that kind of team support that you're talking about. I won't keep you too long. I just a few more questions. I'll put them together. You talked about the regeneration of deprived areas. I'm just wondering, could you touch a wee bit more on that? I find that a really interesting point. And also on the matter of eating disorders, do you think we need to change our approach from an educational perspective and to get in younger with the early intervention aspect of things? And if there's any conversations around that ongoing, I'd love to know more. Thank you.
Okay, so the regeneration of deprived areas, it's about, again, creating that sense of well-being that, that because you live in this area, you deserve nice things. It's about the nice playground. It's about the community provision. It's about what's there. It's about how we look after the area. It's everything. And that helps people feel proud of themselves and proud of where they're from, which is enormously important for well-being and reduces the risk of mental illness. So it's very simply just targeting those areas that have been disadvantaged, and we know where they are, like we're well aware of them. But there's such a social class gradient in Northern Ireland in terms of mental health. It's really, really huge. By just putting nice things into deprived areas, we can make a big difference to the problems that we have, because it's that lack of hope, it's that psychological instability, the lack of psychological safety, that that our children have a good future. If you're a parent, you just want the best for your child, and then you feel safe, you feel secure, you can be content and happy then as well. So that's really, really important. So when we're thinking about where we're locating jobs, where we're locating new businesses, where we're incentivizing businesses, and how we're incentivizing businesses, that's what we should be looking at as we go forward. So that's something for the economy, for all of those other, it's cross-departmental again. It's outside of the mental health strategy, unfortunately. So eating disorders. Yeah, so it is just really worrying that young people are controlling their eating. and that, you know, all of these fasting diets and things like that, that feeds into it, as well as a culture that you know, privileges and sets as a positive role models people that are way too thin, you know, and it's all of that stuff really, but it's also about recognizing that how we eat is part of our well-being, and maybe even GPs asking about eating, you know, are you eating well? And we know there's a big problem, for example, as well with malnutrition in older people, where they're not looking after themselves properly, maybe after a spouse dies and things like that, you know. And a hungry animal will feel frightened, you know, that's a very natural response, that fear, but it's also used as a way of controlling your emotional response. So it's a very complex thing, but by getting the message out that eating well, and I even hesitate to use the word diet, but eating well is part of looking after yourself, it's part of self-care, and that's what we need to be doing as we come out of this pandemic, and not worrying too much, I guess, about weight gain and those things, but just raising awareness generally about the importance of eating behaviour. I mean, it is so scary when we hear of people being admitted to hospital dangerously underweight, you know, because this has gone out of control, but it hasn't really been noticed. And people with eating disorders will cover it up. You know, they will cover up what they're doing. And the other thing, of course, is binge eating disorder is something that's really not recognised as well. But that's a big problem, where people eat large quantities of food. Again, it's about coping with stress, it's about regulation, but it can be quite harmful, you know. So everything we do, our relationship with food is so important, and we need to try and promote that in a much better way in Northern Ireland.
Thank you very much, Siobhan, and thank you, Cara. And Paula Bradshaw, go ahead, Paula, please.
Thank you, Siobhan, for coming this morning. It's been fascinating, and a lot of the issues I was going to raise have already been raised, which is good. But I just wanted to pick up on that last point around eating disorders, and I was sort of getting to it last week with my technology field, and it was really about people who are maybe overweight and aren't maybe diagnosed as being bulimic or others. And I'm not saying everybody who's overweight has got a mental health problem, but I do think that there is a link then, as you say, towards sort of your self-esteem, and especially during lockdown, there's the potential then people put weight on, clothes are starting to get a bit tighter and stuff, that I think there's a wider issue around our relationship with food. So just if you can reflect that in the mental health strategy. I just wanted to pick up on a couple of issues there. You had talked about some outreach for certain sections of society at the far side of the pandemic, and I suppose I would just be sort of championing the people who would have been shielding the CEV, who've been very anxious. And also, I don't think many people have given enough recognition to those who have been on furlough in the retail or hospitality sector. You know, their sense of purpose of getting up every day and going to work and earning a living, even though they've got an income, I suppose we sort of forget. We think, oh, well, they're still getting paid, but you know, they're maybe at home and say not having that fulfillment that we get from work and interacting with others. So again, that's another one I'd raise. But the last one would be around those people who are on waiting lists. We had a Royal College of Surgeons last week, and then departmental officials briefed us on the waiting list, and I suppose the delay in getting your diagnosis, whether it's neurological or musculoskeletal, you know, dealing daily with pain and concerns about what your life was going to turn out once you get your diagnosis. So just wondered if you could speak to just really engaging with certain sections of society that are maybe hard to reach.
Yeah, so really good points. The first one on obesity, I mean, the penny's only just sort of very recently dropped with me that obesity is actually on that spectrum of eating disorders, and binge eating often contributes to obesity. So how we talk about obesity is really important too. And you hit the nail on the head there. It's about our relationship with food, and it's about our self-care and self-compassion. It's about self-awareness, recognizing when we're struggling and how we use food and feeding ourselves well and all of those things. So again, a more nuanced conversation about food, and also the physical activity does help with that as well. You know, and it's good for your mental health and well-being. So I've been really struck by the health psychology community. I've been saying recently about how some of the anti-obesity campaigns can be quite triggering for people who've got eating disorders. So we just need to be aware of all of that when we're planning what we're doing, and it needs to be in the strategy. You're absolutely right, and I'll be adding it to my response as well. Obesity as well as eating disorders. The group here on furlough, much of the data is saying as long as the financial security and as long as they feel stable again, that their jobs are not at risk, that they're not doing too badly. But you're right, there is that fear of coming back out again, of, even the weight gain or whatever it is. For me, it's wearing heels again and having to commute and stuff like that. That's going to be really tricky. And we need that sort of staged return and a wee bit of flexibility from employers to help us navigate that. Because if we're coming to work and we're stressed and anxious, we're not going to be doing too well either, So it's about recognising how all these things play together and taking the good out of what has happened over the past year. So if we can do a couple of meetings by Zoom, not everything, please. But, if we can do that so that people can spend more time with their kids, that would be brilliant. Like, that's trauma informed because you're prioritising those really crucial relationships. So that's what I would say about furlough. But just being aware that there is anxiety out there right now, and lots of people are a wee bit scared. But we'll be okay. The transition will be all right. It was a big shock at the start, so we can do this in a more staged way. The final bit about waiting lists, this really worries me because, that's also a competition for funds from health, to tackle waiting lists. And it's really important because people are deteriorating on waiting lists. They're, chronic pain. Oh my goodness, like that just creates mental illness there. You've got the two things together. You've got something that's creating more mental health problems, and you're going to need more money to try and solve that as well. It just must be a priority, but we can't kind of wait for waiting lists, and this is why the mental health strategy's got to be actioned straight away. So this is a separate area of health, and I just hope that there are people looking at it, and I know the minister's very, very concerned, but this is something that, it's going to take billions, isn't it? But we need to do this to turn Northern Ireland around. We absolutely need to address waiting lists, but we can't. We need to move on with mental health and prevention and mental health services at the same time. So that's kind of my focus and my role.
Thank you. Just to come back on one point there, I'm very supportive of the ambition around the trauma-informed society. And I'm just wondering how you're linking in then with the Safeguarding Board of their work around ACEs-informed society. They're a couple of years ahead of you, and I think they've done some amazing work in terms of teachers and frontline staff like police officers and stuff. So I'm just wondering what way you're interacting with the Safeguarding Board. Thank you.
Yeah, I've had several discussions. So prior to this, in my university role, I've been developing trauma-informed. ACEs informed as trauma-informed. It's about the awareness of childhood adversities as impacting on that biological stress response. So ACEs is really it's about trauma in childhood and the absolute, importance of avoiding them and recognising early what the result of trauma in childhood and what it looks like and what it is. So it's all part of the same thing, and it's brilliant that I can see the ripples already through the police, through the prison system, through my contacts with criminal justice. This is part of the language that they use when they talk about ACEs and trauma. The danger with ACEs is the ACE scale is a kind of a checklist, which leads us down the road of counting up traumas and going, oh my goodness, everybody's ill, which is not what we want, if you know what I mean. So it's about recognising that we are so hugely resilient, but we need to nurture those relationships and connections in childhood, so that we get healthy adults who will be able to cope with stress and pressure and not create any more stress and pressure for themselves through the way that they engage with others.
Okay.
Thank you very much, Siobhan.
Thank you, Paula. And I'm going then to Alan Chambers. Go ahead, Alan, please.
Thank you, Chairman. Siobhan, I'd like to thank you for your presentation this morning and appreciate the energy that you've brought to your post. And I know that you have been highlighting that mental health issues are not something to be hid behind closed doors or closed curtains. My question is, it's not a criticism aimed at anyone, Siobhan, but I know that there have been worrying gaps in the past. And it's around the issue of the police, the PSNI. And I'm just wondering, are there established pathways for the police to direct people who may have come to their attention, might have walked into a police station, or might even have been arrested for a minor offence? Are there pathways for the police to direct them directly to mental health services and advice? Thank you.
This is a really important point, Alan. Yeah, in some places there are. It's it's patchy, and it really depends on the nature of the person's needs, in terms of their mental health and what substances they've taken as well, and also then if the person is in custody or even in prison, that's different again. So that linking up of health with the criminal justice system, we need to improve that. But the crisis intervention services that are around at the minute, certainly the one that I'm familiar with in the Northwest is a very good liaison with the police. So police can, bring people there if they're in a suicidal crisis. And those multi-agency response teams, again, they can help people in a suicidal crisis. But unfortunately, whenever people are in the criminal justice system, it can be difficult for them to access mental health services, and that link between justice and health needs to be strengthened. And that actually would be one of the criticisms of the strategy. The strategy is a health strategy, but how does it connect with justice? How does it connect, with education as the other one? So we need to make sure that those lines are there so that there's a referral there for people who are in contact with criminal justice. Because it's really important, because mental health is related to offending behaviour. Because if those stress responses lead people to externalise, people get angry, they get aggressive, and they get into trouble, and they end up in criminality. So if we can get in early with all the prevention stuff and the trauma-informed stuff, we might actually reduce this at the other end of it too.
Thank you, Siobhan, and keep up the good work. Thank you.
Thank you, Alan.
Okay, thank you very much, Siobhan. That was, I think, a really, really good session, a really good catch-up. The committee have been quite aware and concerned of, the issues that are facing us in terms of mental health. And I think it's right to also look at the positives and look at how we can support each other and all of that. I'm not always happy about the use of the word resilience, and that it sometimes doesn't deal with the underlying problems that are causing the issues. And I recognise that you have also pointed out some of those very, very key issues going forward. And I think that's really useful. So listen, I want on behalf of the committee to thank yourself and Peter for coming along this morning, to thank you for your work to date, and to indicate that we certainly as a committee will wish to support you and anyone else who is including the executive with the mental health action plan and all of that. We will be very keen that this area will get a particular focus. And I think we're all particularly aware around children's mental health and the additional difficulties that this pandemic has created for them around the whole issue of school and sports and all of that. So I want to wish you and all of your team the very best of luck in the time ahead. And I think we certainly will all look forward to reviewing and keeping in touch with this issue as it develops and seeing how this can all be addressed and rolled out. But for now, thank you.
Thank you so much, Colin, and thank you, everybody, and take good care of yourselves. Bye-bye.
Thank you, Chair.
Okay, bye. Okay, members, any quick comments in relation to that? I thought that was a really, really good session with Siobhan. Is there, and I think it would be important that we build into our forward work programme a review of this again sometime down the line in a reasonable sort of period of time, just so we can keep our finger on this particular pulse as well. Carol, go ahead.
Chair, it's just that issue I raised around the 40% funding is in relation to Belfast Trust, but I imagine that will be replicated across other trust areas. And I think it would be really appropriate just to ask the Minister and the department even, what is the situation regarding these primary talking therapies and the hubs, because it's really concerning at this stage that they're being cut to up to 40%, and they're also being asked to pay additional thousands of pounds a year for insurance in relation to cybersecurity. It's going to mean those grassroots support mechanisms are going to disappear. I'm not being alarmist. That's potential impact.
Okay, so we're proposing that we ask them, write to the Minister and ask for a breakdown across the other trusts. Members content with that?
Chair?
Yep, go ahead, Paula.
Thank you, Chair. And I was going to actually raise that issue myself, Carol, so thank you. I am concerned they keep setting up things like the mental health hubs, the family support hubs, assuming that the community and voluntary sector is going to be there to actually pick up the referrals. So I'm wondering if we as a committee should be looking at the role of the community and voluntary sector, not just in mental health, but in terms of other frontline health and social care services, to really get a feel for how they have fared through the pandemic and what support we could provide them, not just financially.
Okay, thank you. Members content with that? Yeah.
Very content with that.
Yeah, thank you. Okay, members, we are then moving on to looking at some of the SRs following this, but if I could ask for maybe if we could take a 15-minute break at this point and members resume just after 12:20, if that will be okay, members. I'll see you all then. Thank you. Okay.
This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly.
So we will now resume our meeting, and we will be moving now to consideration of SR 2021/46, the Health Protection Coronavirus Restrictions number 2 Amendment Regulations. So I refer members there to your papers at tab 7 of your pack, and particularly to the clerk's memo at tab 7.1. I can advise you members that a departmental official is here today to brief the committee on the provisions of this SR. So I'd now like to welcome Miss Liz Redmond, and Liz is Director of Population Health in the department. So Liz, are you able to hear us there? So I see where Liz has now been brought into the spotlight. Liz, are you able to hear us there?
I can hear you. Can you hear me?
I'm hearing you now. I'm not seeing. Yes, now I'm seeing and hearing. And Liz, if you do have access to a headset, that usually helps. But
right,
we will see how the sound goes. But listen, Liz, could you go ahead just and give us your briefing in relation to this item and this SR? Thank you.
Okay, tell me to speak louder if you're struggling with hearing me. So
a little louder would actually be a little bit louder maybe might be useful, Liz. Thanks.
All right. Okay. Look, thank you so much for inviting me today to speak to you. So as you've said, we're considering SR 46. That's amendment number 5 of 2021 to the Health Protection Coronavirus Restrictions number 2 Regulations, Northern Ireland. So as I usually do, I'll briefly summarise the context and then the content of this statutory rule, and then take any questions after that. So if we start with the context, the amendment regulations we're discussing today arose from decisions made by the executive at the 7th formal review of the restrictions regulations, which took place on the 18th of February this year. At the time of the 7th review, the R number was generally decreasing for positive cases, hospitalisations and ICU occupancy. There were 460 COVID positive inpatients across the system, and that was down by a quarter over a 10-day roughly period. However, the numbers of inpatients were still extremely high in comparison to the first wave, for instance, where our peak in the first wave was 322 compared to, on the 18th of February, 460. These numbers were also higher still than when we brought in the 4-week restrictions on the 16th of October. At that time, they were 373. So it's just to give you an idea of what the hospital system was dealing with 4 weeks ago. The ICU occupancy of COVID positive patients had fallen slowly from the peak of 74, which was recorded on the 25th of January. And at the time of this review, it was sitting at 51. So that was a welcome decline, but it was still a very serious situation. The numbers in ICU were only just below the numbers we'd seen in the previous 2 peaks. So just to remind you, in April, we had a peak of 54 in ICU, and in November, 55. So also at the time of the 7th review, we had results in from different sources of genomic data, which suggested that the B117 viral lineage, that's the so-called Kent variant, was accounting for approximately 70% of positive cases in Northern Ireland. This variant was estimated to be up to 70% more transmissible compared with the previously dominant variant, meaning that under conditions of increased interpersonal contact, the number of cases could rise very sharply. This would make the control, obviously, of community transmission more challenging and result in increased infections rates and hospitalisations, deaths, and more pressure on the healthcare system from what was already a very high base. So very important that we were very cautious at this point. In addition, there was uncertainty regarding the presence of other new variants, such as those that had recently emerged in South Africa and in Brazil, neither of which had been identified in Northern Ireland at that time. And there was another concern around this, which was mutation of the B117 variant and the possible impacts of that on a population that was still quite exposed and a health system that was under a lot of pressure. So at the 7th review, the executive agreed that the existing restrictions should remain in place. They were necessary and proportionate, and they should be extended to midnight on the 31st of March, with a next formal review to be completed on or before the 18th of March, which is today. The SR we are discussing today amended those dates in the regulations. As well as amending the dates, the 7th review at the executive considered what small amendments might be appropriate at that time, and the executive agreed to 4 additional changes to the restrictions, as well as the change in the dates. So from the 2nd of March, that was the day after this SR was made, the amendment from that date permits customers of the Motability service to be accompanied by a carer to collect the Motability vehicle. From the 8th of March, the amendment allows 3 further activities. It permits click and collect to operate for specific non-essential retail businesses, that's shops which sell baby equipment, clothing, footwear, or electrical goods, under the condition that payments are completed at the time of the order, be that online, by phone, text, or post, with no cash transactions permitted. The second amendment was around the increase in the number of people permitted to gather socially outdoors from a maximum of 6 from no more than 2 households to a maximum of 10 from no more than 2 households, while restrictions on all other outdoor gatherings, including sporting events or gatherings in private dwellings, would remain unchanged. And lastly, it permits government departments to use conference facilities to hold public inquiries. So just a few specific comments on these 3. Regarding the Motability scheme, there was an issue of practical difficulty highlighted by the examiner in her report on SR27, you might recall. That's of amendment number 3, and it was also discussed at this committee previously. The amendment addresses that issue of concern by allowing that carer to accompany the person to collect their vehicle under the Motability scheme. The amendment allowing limited opening of contactless click and collect of non-essential retail followed a consideration by the Department of Health and the Department for the Economy as to how click and collect services for non-essential retail business could be managed more safely. Following those discussions and engagement with retail businesses and representative bodies by the Department for the Economy, they took proposals to the executive. The Department of Health recognised that as a consequence of the prolonged closure of non-essential retail, items that may not have been essential in the short term had become increasingly essential over time due to wear and tear, breakage, or children's growth. This department also acknowledged that a staged approach to resumption of click and collect services may have a less of a negative impact on the positive progress that we were making in terms of turning the case numbers around and the hospitalisations and ICU capacity, as I outlined earlier, rather than a blanket approach to introducing across all retail at the same time. So the executive decided to introduce phase 1 of the click and collect proposals of DFE. So as I mentioned, 8th of March, this covered baby equipment, clothing and footwear and electrical goods. It was considered that this was a way to test the approach more thoroughly, with a review of the evidence then relating to the impact on transmission and on compliance before a more wide-scale rollout of click and collect in non-essential retail. And finally, the change around the government departments being permitted to use conference facilities. So the conference facilities are required to close, as you know. Now, we had extended the use of conference facilities for holding courts, tribunals and appeals services activities. So this was an extension of that. We engaged with other departments on the numbers of attendees that would be likely for public inquiries, as well as the mitigations that would be put in place. And our Chief Medical Officer and Chief Scientist were content to support this change. And so that was put into the regulation. So to summarise, SR 46, Amendment number 5 of 2021, was made at 4:30 p.m. on the 1st of March, came into operation on the 2nd of March and on the 8th of March, and remains in place today. So I hope that provides you with some background and context to these amendment regulations. And I just want to remind members that the scope, of course, of these regulations is far-reaching across all the responsibilities of the executive. So if I'm unable to provide an answer today, I'll certainly come back to you subsequent to the meeting. Thank you.
Okay, thank you, Liz, and that's very good context and a very good refresher in terms of the context of how that all came about. So thank you for that. I will go across now to members for questions, bearing in mind what you have said there. So I'm going to go first of all to Pam Cameron. Pam, go ahead, please. I'm just waiting momentarily, Liz, for Pam to be brought up into the spotlight to feed in her question. If that doesn't happen within the next minute, I think it is happening. Yeah, go ahead, Pam.
Thanks, Chair. And thank you, Liz. Yes, that was very useful overview and a reminder, because it's very easy to get to basically forget what's gone before. Things do move very fast, although probably not fast enough for a lot of us at the minute. In terms of the click and collect issue, I mean, certainly I think it remains a big issue for us as a party, and certainly our view in terms of, babies and young people and that very limited form of click and collect. And I have raised it before and talked about, for instance, I don't know how much good it would have been to me. Certainly, I mean, I don't have any young children anymore, but when your children are at a very young age, their feet grow very, very quickly. And it wouldn't be sufficient for a mother or father to decide what shoe size their child is. So I don't know how much use that has been for parents, being able to, order a pair of shoes and pick them up and you're just taking a stab in the dark at what, that need is for the child. It is important that their feet are looked after, because that can affect all sorts of other physicalities around it. So I do think we should, it's maybe not very balanced in terms of that provision, and certainly even for pregnant mothers and needing to choose a pram to suit their stature and their needs, that type of thing I don't think can be done really, remotely the way we have been doing it. And I do think the department should be looking at how they can go towards a more appointment-based system, something very controlled that would allow, a much better service to be provided. So I suppose on the back of that statement, Liz, could you tell us what the response has been from businesses in those sectors where click and collect is currently permitted?
Okay, well, my understanding from our economy colleagues are that they are in regular, in fact, daily contact with the three main retailer representative bodies, and also with the environmental health officers who are responsible for enforcement. So my understanding from talking to my colleagues in DFE is that the compliance with the businesses that have opened has been good to date. And that's the sort of feedback the executive's going to need before they move on to the next phase, which would be looking at a wider opening of non-essential retail click and collect services. So the feedback that I've got through DFE, who are the ones in the front line of this, is that it's operating well. I do understand that it doesn't help all small businesses. In fact, some small businesses really struggle with it, and I can understand why that could be. But certainly, if you want to have a more direct feedback from them, we could always invite them along to these sessions if that would help. DFE, that is. DFE officials who are doing that direct engagement.
I'm just because it would be good to know whether they're, is that, is the negative aspects of it, is that being reported back and is that information being gathered? I'm just not sure how that would work in terms of children's shoes in particular. I just don't know how that would work.
Yeah, I think the children's shoes is an interesting one, and in fact, any clothing for growing people. I truly understand the challenge of that. Unfortunately, any time a person goes inside, the risk of transmission between people, however careful they are, does go up. And that is why this very cautious approach at the moment. So measuring feet would mean people would have to enter the shop, and inevitably that would lead to trying on shoes and so forth. So at this stage, we don't think that we're ready to allow that in terms of the rate of community transmission, the number of positive tests we're still getting. It's a fragile situation, and none of this is ideal at all. It's about finding some pathways through it. I did actually wonder whether shoe retailers in particular had come up with any way to put tools online for parents to, in fact, measure their own children's feet with tape measures. It's something I've put to DFE colleagues actually, because that would seem to be a solution, and somebody in the world must have cracked that one, a way to do self-measurement of feet. But yeah, it's not ideal. I completely accept it, and that is why these things are under constant review, and the next step is to look at whether we can do a wider opening of click and collect, and that's what was announced this week. It doesn't solve, however, the concern about the fitting. I completely accept that's very difficult without having contact indoors, which is the very thing that we want to leave until later, really.
Yeah, I mean, I don't want to labour the point, Liz, but given that children are going back to school as well, and we know a pair of school shoes, they're on children so long, and it's so important that they fit properly. So, and I don't think there's any. I wouldn't like to see people kind of self-measuring, trying to fit shoes, because we're not experts in that type of thing. So I don't know how appropriate that would be at all. And I think too, we're also missing the point that, I'm sure many parents have been forced to go to supermarkets and kit out their kids with shoes there and clothes there, which, it makes a moot point in terms of, bringing people into shops. You've got crowded supermarkets, massively crowded and no control there. And yet we're worrying about opening up a shop and having an appointment system so that people could actually get the appropriate clothing and footwear. I do think it needs looked at again, in truth. But I'll leave that there, Liz, and just ask, as more regulations are relaxed, and I'm wondering, will the department extend its cluster outbreak monitoring to include retail sector and publish the findings so that we have some evidence as to the impact of opening in certain sectors?
Yes, look, the monitoring they do already encompasses retail. So I don't know if you've yet picked up that the PHA regular reporting now includes reporting on situations where clusters are found under general categories. If you haven't located that, I could send you the link. But retail at the moment, I'll just find it if I can quickly, but retail at the moment is the place where it's the second highest place. The highest place is workplaces, and I think at the moment when you look at the settings, it reflects where people are currently permitted to go. So it's really proportional to that. Wherever people are able to mix, that's where you're getting clusters and settings. The second highest numbers are related to retail, and that's staff, because of course staff are going in and they're mixing, and of course, as you've rightly pointed out, the big supermarket chains are open, so there's staff in there working through the day and night there. So we know, looking at, and when you see this, you'll see all the categories 0, 0, 0. That's just because those things are not happening in our economy at the moment. But I think what this shows me is that wherever you've got people who mixing indoors, you're going to get clusters and outbreaks at the point we're at the moment, which is we haven't got this virus right down. There's still virus. We're still getting in the order of 170 positive cases a day. And if each one of those people infects 2 others very quickly, you've got that escalating situation again. I think that's what we're so concerned about.
Yeah, and I do appreciate that, but I suppose we have to take into account the new variants as well, and the fact that they're more transmissible. So I completely get that, but I do still think that if you're almost forcing everybody to go to the same venues, and you're actually causing a crowded scenario. I mean, the supermarkets are crowded; they are. So I do think if you had other avenues and other ways to open up safely, they should be taken, because really that's going to actually reduce those crowds and surely be more controlled. But I'll leave it at that.
Yeah, I was just going to say, your suggestion about appointments, I think, is really a valid suggestion, and I'll certainly make sure our DFE colleagues who are in the lead on this have that feedback. I'm sure they're looking at it. I know they're definitely examining how they can get through this. So and make
appreciate that. I did think it would have been already looked at, because it was raised with the minister here in the chamber, and he did respond to it positively, and that was a number of weeks ago.
I'm sure it already has been. It's not my remit directly to undertake those discussions with the retail sector, but as I say, I'll feed that back to DFE colleagues and just make sure that it is definitely on there.
Appreciate that. Thank you.
Thank you, Pam, and thanks, Liz. Going then to Paula Bradshaw. Could Paula be brought up into the spotlight? And go ahead, please, Paula.
Thank you very much. Thank you for your presentation. Pam very much covered a lot of the concerns I have had around supermarkets and the crowding in them, so I won't repeat those. I suppose the only other aspect of it would be around the garden centres and the florists, and even just the fact that a lot of their goods are perishable, if that's the right word for flowers and plants. So just a real mention to them. A lot of them are outdoors. And I think that it'll be very difficult to have community transmission in that setting. But I just wanted to touch on the wider issue there, and I'm very conscious you mentioned around the variants and pressure on our health service. But I think we're about 80 days since Christmas, and our young people have been off school. They haven't been at university, they haven't been at their sports clubs. Many of them young people who work in retail and hospitality have been on furlough. And I think the truth is that the young people are meeting. I think they're going to house parties, not just in the Holy Lands that I was going about it, but I think that they are meeting. And I think that it's absolutely understandable that they feel like they're caged animals, and they're finding ways of circumventing and breaching COVID regulations. And I suppose we were all young once and we could understand that. So is there any work looking at even just the behaviour of young people and ways in which we can actually provide them with more opportunities to meet, but provide them with enhanced guidance, around managing risk, minimising risk, to allow them to come together safely? Because it's quite startling when you think that in sort of 80 days that the executive are under the impression that they haven't been meeting, when I have an 18 and a 21-year-old, and it's like trying to put a bolt across the door that they don't go out to these parties that their friends are going to. So I suppose it's really just about how we are realistic about what's actually happening in our communities, because the daily cases are showing that not everybody's sticking to it. Thank you.
Yeah, no, thanks for raising that. There is a work stream of the executive task force looking at adherence, and it's looking at the behavioural aspects of that. I haven't got familiarity with the details of the work they're doing, but I know they have commissioned work, and I'm almost certain they'll be looking at youth behaviour for all the reasons you've laid out. So yeah, there definitely is a work stream on that. We're very conscious of it.
Okay, thank you. I'm not blaming them. I'm just saying, like, if we're going to have to live with this virus, we're going to have to manage their behaviour, and isn't it better to support them with guidance as opposed to lump them with fines and penalty notices? I suppose the other aspect that's been raised with me are around the coffee and the ice cream vans that are in our parks. Obviously, people have very few places to go if they're not shopping, and it's really just around the safety of those. And I'm not persecuting those people who are trying to earn a living and provide a service, but I do have heard a number of complaints around the lack of social distancing and concerns for community transmission around those sort of pop-up venues. Thank you.
Yeah, well, thanks for raising that. Yes, I wasn't aware of the particular concerns that you've just raised around those places, but that would be something for the local authorities to look at, I think, if it's a problem. Yeah, so we'll just relay that back. Yeah.
Okay, thank you.
Thank you.
Is that you, Paula? Yeah.
Yes,
okay,
sure.
I'm going then to Carol. Yeah, thanks, Paula. Going to Carol Neekillen then. So could I ask broadcasting to bring Carol up into the spotlight? And please go ahead, Carol. Carol, we're not hearing you there at the moment.
Sorry, can you hear me?
We're not able to hear you.
Okay, sorry.
Yeah, hearing you now.
Okay, Liz, it was just in relation to the role of local government in terms of, health and safety of customers. What role, like, for example, the health environmental teams would have at the councils. And the other thing, I think this is about the third time that we've raised this with the Minister. So, for example, your position in relation to retail has been informed by the Department for the Economy, okay? But yet when we were talking to the Health Minister around, for example, young people, the Education Authority were very clear that they were adhering to health guidance. So perhaps you could clarify in which sequence all this comes, because my understanding is we all agree to the health guidance. So, at the end of the day, the department needs to make a decision based on what they get from other departments. I just want to know if that's the case.
Right. The Department of Health provides the health advice, but these decisions are decisions of the executive. So I'm not. So the health advice comes before the decision of the executive to make changes to the regulations. I'm not sure if that is what you're looking for. No.
No, I'm sorry. I'm aware of that. What I think isn't clear, so let me just be completely clear if I can. So, for example, in your response to Pam earlier, you said that you were talking to colleagues from the Department for the Economy in relation to measuring children's feet in terms of retail, the click and collect, okay? So is it a case that you get their advice, you bring it to the Department of Health, and the Minister brings it to the rest of the executive colleagues? Because it seems slightly confused if that's what the approach taken with one department. But yet and all, if you talk to the Department of Education, particularly the Education Authority, youth workers, diversionary youth workers could not, absolutely not, meet young people who were vulnerable if it was more than one on the ground, because they said of the health advice that they got from the Minister. So that's what I need clarified, please.
The proposals, I'll just stick with the retail one because I'm more familiar with that. The proposals on retail were brought by the Department for the Economy, but officials across government departments work collaboratively together to inform each other's policy development. That's joined up government, which we strive to achieve. Ultimately, the executive makes the decisions about these things. Health advice is clear at the time that those decisions are considered and taken. But I mean, certainly sometimes because of the way we are leading on these regulations in health, but the regulations cut across all departments, we end up reflecting to the executive on the totality of things. But essentially, in the Department of Health, we provide health advice and we lead on making the regulations because of the way the legislation is structured. These regulations sit with us, but the changes we are making to the regulations are based on the decisions of the whole executive together collectively. They're not unilateral decisions by the Department of Health. Guidance is additional to that in many cases, because we are not only relying on regulation to tackle this pandemic, there's also guidance out there that is not directly embedded in regulation in any way at all, in fact. And sometimes departments that are creating guidance will take advice from us on parts of that guidance, but they will be leading on the guidance. They might ask for our particular health input. And of course, there's general lines about the public health approach to this. But general public health guidance is often reflected in a wide range of departmental guidance that we don't directly write or have input into, but that general public health guidance is there for all to draw upon. So again, I'm not really sure if I've been able to answer the core of your question there, because I'm just struggling a little bit with the concern. Does that help at all?
The concern is, Liz, I appreciate you trying to, you're obviously doing your best. The concern is that we have hundreds of young people who, for example, yesterday evening, despite everything else, most young people do adhere to the health guidance. But we have hundreds of young people who are engaged in youth diversionary services, and their youth diversionary workers are telling us that they are not allowed, under legislation from the Department of Health, to engage with more than one, possibly two vulnerable young people because of health regulations. So it's just so you can bring that back. That's what we're being told. And the Education Authority have said that as well. Okay.
Right. That's actually really helpful. That's very helpful. I think I can see where you're coming from now. And I probably really need to go to the part of the regulation that says that the gatherings limits don't apply where there's an issue of health or welfare. I haven't got the exact words in front of me, but it definitely, if there's an issue around somebody's health, well-being, their safety, then that's an exception in the regulations.
No, so they understand that, Liz.
They do, right?
Of course. So,
yes.
But the issue is, if you're dealing with, if it's any more than one person or two people, then you're in breach of the regulations, and they're saying that's not sustainable for the mental health of young people. So perhaps if we could get more information on that, and then what relationship, if any, do local government, particularly through health environmental, have in relation to retail around health and safety? I mean, I have to say the supermarkets have done exceptionally well, but I've walked out of them twice because of the numbers. I haven't felt safe getting in, and I think particularly it's unfair on smaller businesses when the same goods are being sold at supermarkets and small businesses have been closed and can't can't open their businesses because of health restrictions, but the same goods are sold in big supermarkets. There's an injustice there.
Okay, thank you, Carol, and thank you, Liz, for that presentation, for dealing with those answers, and for committing to bring back a number of issues that the committee have raised. I think that's a very useful approach, and I do think that sort of demonstrates the value that we can add in terms of to and fro conversation in relation to that. So thank you very much. I'm not seeing any other indications from members, Liz, so I think we can allow you to drop off and we will continue with our formal consideration of this SR. Thank you for your time today. Okay, Liz.
Thank you. Bye now.
Okay. Okay, members. Thank you. I think I just do want to note, I think the initial presentation there was very good in that it set out the type of issues that are being considered, the type of rationale that was being applied to the SR, and I think that was actually very, very useful. As was the commitment to take issues raised and have a look at them. I think that's what we would be hoping for in relation to our impact and scrutiny and advice role in relation to all of this. Any other issues that members wish to raise at this point before we look at the more formal consideration?
Chair.
No. Yes, Pam.
Yeah, it's just to say, I mean, I think that you're right. I think it was a great presentation from Liz, and it was good to get that overview. But it's pretty frustrating that when you've raised something with the minister a matter of weeks previously, and he seemed to take that on board, you'd expected that to have been put into the system somewhere, even as a thought or an idea, and that obviously hasn't happened in terms of children's shoes. And it just seems to me that there's so much concentration in, keeping people apart, that there doesn't seem to be any kind of forward thinking about, well, how can we do this and how can we do it in a structured way that is safe and is better than crowded supermarkets. And that seems to be completely ignored, that reality that you're pushing everybody to the same places as opposed to spreading them out. It just doesn't make any sense to me as time goes on. I do understand, but I don't know where we go from there. I wonder, maybe should we as a committee, could we agree to write to the minister and ask him around those specific areas that we're really concerned about? Because I just think it's really, really important that the children have decent footwear. I think it's really damaging to wear, and you talk about very, very long periods of time where they've had to do without. And I'm sure.
I know.
Sorry, go ahead.
I know what you mean. I've young children that age myself, and they do shoot up very, very quickly. In fairness, I think Liz was trying to say that she wasn't saying that it hasn't been raised or discussed yet, but that she would check that it has and ensure that if it hasn't, it would be. So in that sense, it may be ongoing, but I would be quite content, and I'll check with other members that we write to check to ensure that it is, and to reflect our concern around that issue, that would be looked at very, very in a very timely way, but also in the hope that it already is being. And I think that was what Liz was trying to say. She couldn't answer for sure, but she will ensure following this meeting she'll follow up on it. Paula was looking in there.
Thank you, Chair. If we're putting a letter in, could we ask for an update on that work that Liz had mentioned around looking at sort of the psychology around young people and behaviour, to see what they're going to be doing around managing that group coming through this pandemic? Thank you.
Yeah, because, and I think that was a valid and a useful point as well, Paula, because as well as the concept of harm elimination, you also see often harm reduction, and within doing your best to eliminate the harm, that you also recognise that there may be times where a harm reduction or a minimisation of harms is also valid in support of that. So I think that is something, if members are content, I think that would be useful. Content, Carol, or are you looking in?
No, I'm content, but I would also like my query raised as well, because I've raised this, like Pam, with the minister who's agreed, and then you don't see anything other than like a nodding head in the Assembly. So I'm not saying Pam said that, I'm saying that, but I think if we can include that in the letter, it will be helpful.
Okay, members content with that element being included as well? Okay, members, thank you for that. We'll now formally consider the SR, and I can advise that it is the subject of confirmatory resolution, and that today is the last opportunity for us to consider it before the Assembly debate on Tuesday, 23rd of March. The examiner has confirmed that she has no comments to make in relation to this rule, and members have raised a number of issues which we are going to reflect to the Department. So in that context, can I ask members to agree formally that the Committee for Health has considered SR 2021/46, the Health Protection Coronavirus Restrictions Number 2, Amendment Number 5 Regulations 2021, and recommends it be confirmed? Are we agreed?
Agreed.
Yep. Agreed. And can I just check, Clerk, that you are content that you have the sufficient detail there in relation to the issues raised by the committee for reflecting on to the department and for asking the department for a response? Yeah.
Yes, Chair.
Thank you. Okay, members. Thank you, members. Moving on then to correspondence, and I will remind members that we will, as usual, lose broadcasting at 1:30, and we have another closed session to take into account. So I just ask members to bear that in mind as we go through correspondence and try to move through it as efficiently as we can. So I refer members to papers at tab 8 of your pack, and there's a couple of items that I want to draw out for members' attention, and then I'll take issues from members as they wish to raise. Items 8.2 and 8.3 in your main pack there, members, in the table pack refer to those and tab 8 in the table pack refer to SR 2021/8 and the Mental Health Amendment Order. This is the one that I touched on earlier with Siobhan O'Neill. The response in the table pack provides an update on the current pressures on mental health services. The responses also advise the Minister has decided now to reverse the amendments relating to second opinions, which will reset mental health legislation to a pre-COVID position. The response highlights, therefore, that this will be the last regular update on COVID-19 specific pressures on mental health services. And I want to acknowledge to the department that I think we would generally welcome the fact they had committed during the briefing sessions around this that they would revoke or remove those as soon as it was practicable. And I think I want to very much welcome the fact that that has been done. It is a key area of concern around civil liberties and the balance of rights and the balance of responsibilities and all of that. But I welcome the fact the department have moved reasonably swiftly to undo those when they could. So any other comments from members in relation to that? Or are members content to note? Content to note, members, thank you. Item 8.6 is a departmental response to issues raised by the committee at the briefing on the COVID-19 cross-departmental vulnerable children and young people's plans. Do members have any comments to make in relation to that response? And I can just for information remind members that we have agreed an informal session with the Children's Law Centre and VOIPIC, and that session has now been arranged for Wednesday the 24th of March at 11 a.m. via MS Teams. So I think that will be a useful opportunity for the committee to take the temperature of how that's all being implemented and rolling out. Are members content to note for now that correspondence?
Content.
Okay, thank you. Any other comments? Is that on that particular one, Paula, or an additional item of correspondence?
No, on that item, Chair.
Go ahead, Paula. Yeah, go ahead, please.
No, sorry, I was saying I was content with that on the last item, Chair.
Okay, thank you. So, have members any other comments or proposals on any of the other items of correspondence before us today? No, so therefore can I ask members that you're otherwise content with the actions proposed in the correspondence memo? Are you content? Thank you, members. And moving on then to table correspondence, there are no further items of correspondence in the table pack that I wish to draw members' attention to. So forward work programme then, I refer you there, members, to the forward work programme, which is tab 9.1 of the pack. Are members content to note the forward work programme? Yeah, thank you, members. And any other business then, members? No, well, therefore, I will just move to the date, time and place of our next meeting. Our next meeting will be on Thursday, 25th of March at 9:30 a.m. via video link. And we will now ask broadcasting to cease broadcasting, and we move into our closed session.
Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly